pretty much have it memorized. What's that? Charter. Yeah.
Yep. Sure. Good evening. Welcome to the May 19th, 2022 Northampton County Council meeting. John Gracedown, will you lead us in the pledge? To the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Just a minute. Ms. Zirinsky's on her way.
Okay.
Roll call, Ms. Zumba?
Mr. Brown.
Here.
Mr. Kuzic.
Present.
Mr. Giovanni.
Here.
Mr. Gofredo.
Here.
Mr. Heckman.
Here.
Mr. Lott.
Here.
Mr. Myers.
Here.
Ms. Fargo Hefner.
Here.
Ms. Zirinsky.
I believe she's on her way.
Okay. All present except Ms. Zirinsky, who is on her way.
Next, may I have a motion to approve the minutes of May 5th, 2022?
Motion.
All in favor?
Aye.
Aye.
Any opposition or amendments? Motion passes. Courtesy of the floor, no one has signed in. Is there anyone here who wishes to speak to courtesy of the floor? Seeing and hearing none. Mr. McClure, do you have a report?
I do, ma'am. Good evening. Act 77 is empirically democratizing. If, as all of us here believe, it is important to have more of our citizens voting, this past primary, which I'll now give a brief report on, offering the caveat that the canvass has not taken place yet, which gives us the official count. So all of our results are now unofficial. But I can report that our turnout, overall turnout, was 32.47%. The turnout in the Democratic primary was 30.2%, and the turnout in the Republican primary was 35.35%. Now, when I said Act 77 is democratizing, I'm talking about the addition of vote by mail. And so in this primary election, I'll repeat, we had a 32.47 turnout rate, which, you know, in some European countries is anemic, but for us, it's really quite good. In 2012, it was 13.31%. In 2013, it was 14.5%. In 2015, it was 12.79%. In 2017, it was 14.45%. In 2018, it was 21.36%. And 2019, it was 11.52%. Interestingly, not all of this improved turnout, it's double, right? Not all of this is vote by mail. More people are showing up to vote in person too. And this is a good thing for democracy. I want to thank Acting Registrar Amy Hess. I want to thank Director of Administration Charles Dertinger. They have done an excellent job getting us through this primary season. I can't thank them enough. The staff of voter registration, our elections division, has done a tremendous job. Thank you to our judges of elections and our poll workers. And thank you to our contractor, ES&S, who since 2019 has come through for us cycle after cycle. We had some power outages on election day. Due to car accidents, nothing election related. There were some other power outages. We rolled generators to the voting facilities, and we got the lights on and people voted, and we had no major complaints about how the primary election was conducted. So that is my report on that. We'll have more specifics at your next meeting, we'll have more specifics. And of course, if you have any questions, specific questions tonight, Mr. Dertinger's here and he can answer them. I have some big thank yous to give out tonight. We have resolved our contractual differences with PSSU, SEIU, our human services workers, and I'd like to thank their team. I'd like to thank Mallory Kennedy and Chris Ellis, as well as our employees who represent PSSU and their fellow workers, Ms. Keezy Johnson, Vanessa Gonzalez Mercado, Stephanie Shields, Kristen Lociero, Kim McCluskey, and Elise Sandoval. They all have earned the thanks of Northampton County for working with us to come to a contract. The parameters of it are 4.5, 4.5, 2.5, no increase in healthcare for the 3 years, retroactive to the beginning of the year. So I thank them very much for working with us on that. As you know, COVID is still part of our lives, and we're still fighting with our drive-through collaboration with Coordinated Health. We have now performed 9,480 tests at our drive-through facility at Emmerich Boulevard in collaboration with LVH and Coordinated Health. And we have provided 4,707 injections of the COVID-19 vaccine, Pfizer and Moderna, I believe they offer there. The rate of infection for the folks who are showing up has stayed at about 29.2, 29.3. It's ticked up recently, as has the number of people going to get tested. I guess some of these people figure it's not their allergies, so they have gone to get tested. So I'm very glad we continue to work there. The Juvenile Justice Center. The Juvenile Justice Center could have been without air conditioning as the weather turns very warm in the very near future. And we are pleased to report that the new chiller is there, and the juveniles who are residing with us now and the people who care for them there will have air conditioning as the temperatures start to climb. So we're very pleased to be able to report that to you tonight. I also want to draw your attention to some news we received from the United States Department of the Treasury. As you know, you've approved an ERAP CMED program, which, as I have stood here and said to you before, I believe prevented a homelessness crisis in Northampton County. The United States Department of Treasury has actually cited Northampton County's program as a program to be revered and modeled across the nation. And they have, we are on their website as being cited as being one of the better programs in the entire nation to do the ERAP and the CMED program. And I'd like to thank all of the people who are doing the hard work in Northampton County, including Robin Barbosa, Tina Smith, Frank Brooks, Sue Wondolowski, Steve Barron, so many people doing so much hard work in Northampton County on this program, preventing homelessness. And I'd like to thank our partners, Project of Easton, Shiloh, New Bethany, North Penn Legal Services, and CACLV. And I commend all of you to go. I have it here. I have the link for the Treasury Department. So you can go on there and read about how we're being lauded by the United States Treasury for our program. Some of you may have seen we've started a warm handoff program in conjunction with Lehigh Valley Muhlenberg. And this program is helping folks who are coming out of the behavioral units who have attempted to take their lives. And we are locating and recommending services and navigating the referral process. We are providing assistance with understanding insurance and how to access services through it, linkage to peer community supports in Northampton County, linkage to other Northampton County services if needed or requested, periodic check-ins from time of referral until 3 months following the patient's discharge. This comes from our Suicide Prevention Task Force and the great work that our Northampton County Suicide Prevention Task Force is doing. I believe you will be seeing our warm handoff program modeled and implemented in other places nearby in the very near future, which is just incredibly flattering to the work that our Suicide Prevention Task Force is doing. And if you'll bear with me for a second, I believe that concludes my report. It does. Any questions?
Oh, sorry, are there any questions for Mr. McClure? Mr. Heckman?
The drive-through for the testing, that's still, you just can show up and, I know you don't.
To get tested, yes.
Tested, yeah. And now what are the hours again?
I don't know, but they're prominently displayed on our website, on their website, on our Facebook page, but I don't know them offhand. They change.
All right, no problem.
Cusick, sorry.
Yeah, I share the comments you made about our election staff. Mr. G and I, just before this meeting, were commenting at how competent our polling place workers were, and I didn't receive any complaints at all. But my question is, and I guess this morning I saw Steve Kornacki at a whiteboard or something. Could you tell us what votes are out there and what needs to be counted? Because I know there's a Connecticut hedge fund manager and a New Jersey doctor that are really interested.
No, but it's revealing to me that you watch MSNBC. No. So what do we have? About 195 provisional ballots? Yeah. Go ahead.
There's about 195 provisional ballots. They have been validating those. Provisional ballots are something that you could have voted in Washington Township for Williams Township, and only certain parts of your vote would count. So they are going through each one of those, making sure that work will start tomorrow morning during the canvass, as well as there were about 27 or so ballots that were not readable by the scanner that we'll be addressing, and then the variations of other ballots that need to be addressed. So no more than 300 votes will be discussed at that point. There are a couple of ballots that the canvass board will look at, including one where the person's signature kind of wrote up and they marked the secrecy envelope with a Post-it note to indicate that she has Alzheimer's and Parkinson's, and her signature kind of wrote up as where it wouldn't be for. So determining that's the validity of that.
Okay, and then the other part of my question is, there also would potentially be a recount. Could you describe to us what would be involved there and what it would cost and who pays for it?
Once the Secretary of State makes a determination that we are within the threshold, we'll be told that a recount takes place. Depending on the type of recount they ask for, it usually takes us for basically your standard recount before we have to go to running ballots through again. It takes the better part of 2 days for 10 or so people to conduct. It is done in our first floor office, and we are reimbursed for the costs of that from the state.
Okay. Thank you. I think we have somebody
Can I
concerned
ask
about it.
Sure.
No, I just, John, thank you for your concern in this election. I really appreciate those questions. What would trigger the Secretary of State to request a recount?
The law.
No, is there like a margin?
Yes.
And what is that?
It's 0.5%.
Because I thought that's only in statewide elections, though.
Correct. I think that's correct.
Because I did read that
Yeah.
this morning.
Yep.
So only statewide elections. So if for some reason the statewide election triggered a recount, would that trigger a recount for all other candidates below that?
No.
No. That's what I wanted to ask. Just checking. Because it's only for statewide elections. I wanted to clarify that, not for,
That's the one they were talking about this
Asking
morning.
for a friend.
Another question that came up, you mentioned the Juvenile Justice Center. Was that an emergency spending that you discussed with the council president to do?
Yes. No, did it go under JCI? It was under the JCI contract.
Okay.
We've been talking
Yep.
about that.
Yeah, it's been out for a while. We had to rent one. there's, last year. Yeah, we were, yeah.
Yeah, the reason why I ask, because in the past, when there's been an emergency expenditure, the executive would contact the council president, we'd authorize, because it went out at Gracedown once. We had to get it fixed and it cost us, a significant amount, and then, the next meeting, we had an approval, so,
Yeah, JCI front-loaded it for us in the contract
okay, thank you.
because we needed to get it done.
Any other questions? I have a question. I know you just wanted to sit down. Is there any update on the housing authority process and what's happening with our hopefully amicable divorce?
So I have pledged to the Department of Housing and Urban Development that I would not comment on the transition while the transition is taking place any further, and I will honor my agreement with HUD to do that.
Okay. Sure.
I'm just curious, HUD requested this.
They did.
Can you tell us why they requested it?
Sure,
The reason?
because the HUD felt as if did you use the word divorce? The divorce was.
Amicable divorce.
Well, HUD felt,
Let's leave amicable.
HUD, before tonight, where I'm not going to comment, HUD felt like the comments that had been made publicly, including Ms. Bartlett's resignation, was not advancing the cause of an amicable divorce. So I pledged to HUD that
They
I would,
requested this, and-
that we would not say anything, but, I won't be gagged forever.
Send a smoke signal when you get some information. Thank you.
I will. I'm sure
Just
Tina will be,
no, 'cause
I'm sure
it's-
Tina would be happy to, bring you up to speed eventually.
It's, it's ongoing, and I know there's a timeline, and I think that timeline was approaching, so I was just curious.
Yep.
Thank you very much.
I ask
Anything
a
else?
question?
Yes.
Would it be appropriate to have an executive session on that to receive an update or no?
No, because it's not a subject of litigation or a personnel issue, or it would really be, it doesn't have to be an answer.
Question for Kevin, but that's okay.
But no, okay, go ahead, let him answer it then. Thank you, thank you.
Just asked.
Yeah, the requirements are very specific.
Okay.
This falls outside those.
Yep,
Thank you.
yep. Thank you for allowing me to honor my agreement with HUD. I appreciate that.
Everybody remember to use your mics, thank you. Although Kevin should be somewhat excused, he's not used to this. All right, old business? Public hearing of an ordinance entitled an ordinance of the Northampton County Council approving the master lease purchase agreement between Pinnacle Public Finance Incorporated and Northampton County, and to authorize the incurring of debt to finance energy and facility improvements to improve the infrastructure at Northampton County governmental facilities. Ms. Zirinsky and Mr. Lott introduced this ordinance at May 5, 2022 meeting. Are there any questions or comments from the public? Mr. Corrier's here to discuss this if we need.
Correct.
We did discuss this yesterday at the Finance Committee, and, do you want to just repeat why we are doing this?
Correct, sure. So back in May of 2021, you passed a resolution for a project development agreement whereby Johnson Controls would work with the county to examine all of its facilities, determine if there were some things that they could do for cost savings and actually for environmental reasons to replace certain equipment that might better serve the county. After about a 6-month due diligence investigation, they came back and said there was basically 7 projects that they recommended. For some of those facilities were like Gracedown Juvenile Justice Center, the prison, 911 building, human services, for upgrades or improvements to lighting, water, steam upgrades, control upgrades, chiller replacement upgrades, which I'm not really sure what that is, HVAC upgrades, and boiler replacement upgrades. That was brought to, that potential contract with Johnson Controls was brought to County Council in November of 2021 in the Finance Committee meeting, which was approved, and then it went to Council the following day. And by resolution pursuant to 13.15 of the Administrative Code, you passed the Johnson Controls contract and agreed that the county could enter into that sole source contract for $7.6 million. So commensurate with that, the administration then took your approval and obtained the necessary financing to fund that agreement, and they were able to contract with Johnson Controls. Closing was held on December 10th of 2021, and the county was able to receive a very favorable interest rate on the loan at 1.95%. Now, it was called a master lease agreement, and the terms and conditions of the agreement are lessor and lessee, and you could certainly read it. There's no liens on the county property. There's just UCC liens on the equipment. If we don't pay, they can take it back. That was all approved. And we're now in front of council. The first debt payment is due in December of 2022. So the administration is recommending that based upon the Home Rule Charter 602 Section 8, since it is dealing with debt service and a loan for monies, we're requesting that the Pinnacle Public Financing Agreement be approved by ordinance.
Thank you. Are there any questions or comments from the public regarding this matter? Is there any discussion from council regarding this matter? Call for the vote.
Ms. Zirinsky.
Yes.
Mr. Lot.
Yes.
Mr. Giovanni.
Yes.
Mr. Gofredo.
Yes.
Mr. Heckman.
Yes.
Mr. Myers.
Yes.
Ms. Fargo Hefner.
Yes.
Mr. Brown.
Yes.
Mr. Kuzic.
Yes.
The ordinance is adopted by a vote of 9-0.
Thank you. Is there any old business to discuss this evening? Hearing and seeing none, let's move into new business. First, we have the consideration of the executive's appointments and reappointments, the Children, Youth, and Family Advisory Board, Farmland Preservation Board, Northampton County Housing Authority, Workforce Board, Lehigh Valley. Mr. Hackman, will you introduce the resolution?
Sir. Resolved by the Northampton County Council that the following individual shall be confirmed in their appointments, reappointments as indicated hereafter. Children and Youth and Families Advisory Board, appointment Cheryl Lynn Fritz, Bethlehem, PA, term to expire 3/22/24. Farmland Preservation Board, reappointment Farmer Director Todd Gulick, Bangor, PA, term to expire 6/30/25. Public Director, under Farmland Preservation Board, Public Director Andrew Theory, Nazareth, PA. I don't have a date on it. Would it be the same? All right, that's same at 6/30/25. Do you want me to go through all of them, and then if anybody wants to pick any out?
Yes. I mean,
All right.
probably can-
Northampton County Housing Authority, appointment Jason Vanderberg, Easton, PA, term to expire 2/9/27. Workforce Board, Lehigh Valley, appointment Business Category Greg Marzano, Northampton, PA, term to expire 6/30/24. Business Category Stephen H. Patterson, Easton, PA, term to expire 6/30/24. So introduced.
I think the terms to expire, because Mr. Thierry is on the second page, I think they're both the same term of,
Yeah,
Yeah.
yeah,
all right. Any questions or comments regarding these? Any discussion? Are they, any of them here? Call for a vote.
Mr. Heckman.
yes.
Mr. Gofredo.
Yes.
Mr. Lot.
Yes.
Mr. Myers.
Yes.
Ms. Fargo Hefner.
Yes.
Ms. Zirinsky.
Yes.
Mr. Brown.
Yes.
Mr. Kuzic.
Yes.
Mr. Giovanni.
Yes.
Adopted by a vote of 9-0.
Next, we have consideration of personnel request, Department of Public Works Resolution. Mr. Heckman, would you introduce this?
Yes. It is hereby resolved by the Northampton County Council that the one full-time position of custodian dash cleaner, pay grade RU 09 1A, salary, excuse me, $23,248 be eliminated, and one full-time position of custodian dash cleaner, pay grade RU 02 1A, salary $28,153 be created in the Department of Public Works Custodial Division effective May 20th, 2022. So introduced, and let me add, this was discussed at the Personnel Committee meeting.
Thank you. Any discussion? Call for the vote.
Mr. Heckman.
Yes.
Mr. Lot.
Yes.
Mr. Myers.
Yes.
Fargo Hefner.
Yes.
Ms. Zirinsky.
Yes.
Mr. Brown.
Yes.
Mr. Kuzic.
Yes.
Mr. Giovanni.
Yes.
Mr. Gofredo.
Yes.
Adopted by a vote of 9-0.
Thank you. Next, we have the consideration of Mincy Lake Greenway and Stewardship Plan Resolution. Ms. Zirinsky, will you introduce this resolution?
Yes. Now, therefore, it is hereby resolved that Northampton County supports and adopts the planning goals and recommendations of the Greenway Plan as follows. The project was completed in accordance with the grant agreement. All project expenditures have been made and were in accordance with the grant agreement. The plan and related materials are acceptable to the County of Northampton. The plan and related materials will be used to guide future recreation and conservation decisions.
Thank you. Any discussion regarding this matter? Call for the vote.
Ms. Zirinsky.
Yes.
Mr. Lot.
Yes.
Mr. Myers.
Yes.
Ms. Fargo Hefner.
Yes.
Mr. Brown.
Yes.
Mr. Kuzic.
Yes.
Mr. Giovanni.
Yes.
Mr. Gofredo.
Yes.
Mr. Heckman.
Yes.
Adopted by a vote of 9-0.
Thank you. Next, we have the consideration of local share agreement grant resolution. Ms. Zirinsky, will you introduce this as well?
Now, therefore, it is hereby resolved by the Northampton County Council. One, the Northampton County Council hereby approves the Gall Farm Preserve Phase 1 Development Grant application to the department. Further, the Northampton County Executive, through the Office of the Program Administrator of the Northampton County Livable Landscapes Program and his or her designee, is directed to take any and all steps necessary to administer and complete Northampton County's obligations in this project. Two, the Northampton County Executive, through the Office of the Northampton County Division of Parks and Recreation, or his or her designee, is directed to take any and all steps necessary to administer and complete Northampton County's obligations in this project. Three, the authorized official resolution may be signed on behalf of the applicant by the official who, at the time of the signing, has the title of Superintendent of Parks and Recreation. Sweet. Okay.
Thank you. Any discussion? Call for the vote.
Ms. Zirinsky.
Yes.
Mr. Myers.
Yes.
Ms. Fargo Hefner.
Yes.
Mr. Brown.
Yes.
Mr. Kuzic.
Yes.
Mr. Giovanni.
Yes.
Mr. Gofredo.
Yes.
Mr. Heckman.
Yes.
Mr. Lot.
Yes.
Adopted by a vote of 9-0.
Thank you. Next, we have the consideration of a memorandum of understanding between Northampton County and Afscme District Council 88, Local 1265 Resolution. Mr. Myers, will you introduce this resolution?
Oh, here it is.
Whereas on May 6, 2022, County Council received a memorandum of understanding between Northampton County, the American Federation of State, County, and Municipal Employees District Council 88, Local 1265, regarding sign-on bonus for youth care workers. Now, therefore, it be hereby resolved by Northampton County Council that the memorandum of understanding shall be approved this date, 19 May 2022.
Thank you. Any discussion? Call for the vote.
Mr. Myers.
Yes.
Ms. Fargo Hefner.
Yes.
Ms. Zirinsky.
Yes.
Mr. Brown.
Yes.
Mr. Kuzic.
Yes.
Mr. Giovanni.
Yes.
Mr. Gofredo.
Yes.
Mr. Heckman.
Yes.
Mr. Lot.
Yes.
Adopted by a vote of 9-0.
Thank you. Next, we have the consideration of commercial use agreement with Twin Rivers Tubing LLC resolution. Ms. Zirinsky, will you introduce this?
Whereas on May 13th, 2022, the Northampton County Council received a request from the county executive for county council to adopt a resolution endorsing a commercial use agreement between the County of Northampton and the Twin Rivers Tubing LLC for their limited use of property along the Delaware River for a 3-year term from May to September of each year, with $250 per week of use paid to Northampton County. Now, therefore, be it resolved that the Northampton County Council does hereby concur with the recommendation of the county executive as set forth in the attached documentation to approve a commercial use agreement with Twin Rivers Tubing LLC. We discussed this yesterday, I believe.
Yes. Any other discussion? Call for the, yes, sir.
Just one. I'm happy to see that this is finally a 3-year deal instead of year after year. For you guys, good luck. Thanks.
Yes, sir.
Just in general, Ms. Zirinsky mentioned it, and sometimes I forget too. I think it's important when we introduce these and we call for the vote, oftentimes there isn't discussion because we've really discussed it at committee meetings. So I just always like to remind the public that we certainly, on a lot of these things, have fairly long discussions at our committee meetings.
And
Yes.
I could add to that, that there was an RFP put out for this, and this was the only bidder. And this is the same company from the previous year, and we're very happy to have them back.
Thank you. If there's no further discussion, we could call for the vote.
Ms. Zirinsky.
Yes.
Mr. Brown.
Yes.
Mr. Kuzic.
Yes.
Mr. Giovanni.
Yes.
Mr. Gofredo.
Yes.
Mr. Heckman.
Yes.
Mr. Lot.
Yes.
Mr. Myers.
Yes.
Ms. Fargo Hefner.
Yes.
Adopted by a vote of 9-0.
Next, we have the consideration of Administrative Code Article 13 contracts. First, we have County Commissioners Association of Pennsylvania. Mr. Cusick, will you introduce the resolution?
Okay, whereas on May 10th, 2022, the Northampton County Council received a request from the county executive for county council to adopt a resolution approving a contract for a one-year term with the County Commissioners Association of Pennsylvania, CCAP, in the amount of $824,746 for property and liability insurance. Now, therefore, be it resolved that the Northampton County Council does hereby concur with the recommendation of the county executive as set forth in the attached documentation to approve a contract with CCAP.
Thank you. Any discussion regarding this matter? Call for the vote.
Mr. Kuzic.
Yes.
Mr. Brown. Mr. Giovanni.
Yes.
Mr. Gofredo.
Yes.
Mr. Heckman.
Yes.
Mr. Lot.
Yes.
Mr. Myers.
Yes.
Ms. Fargo Hefner.
Yes.
Ms. Zirinsky.
Yes.
Adopted by a vote of 9-0.
Next, Elliott Lewis Billetier Electric. Did I say that right, Mr. Myers?
Yep.
It's yours. Would you take that?
Whereas on May 12th, 2022, Northampton County received a request from Northampton County Exec for County Council to adopt a resolution endorsing the contract for the total amount of $404,601 with Elliott Lewis. Is that the wrong one? Yes.
No, that's the correct
this
one.
is-
Yeah, you got it.
I want to make sure that's correct. For $374,000 plumbing, Bellatar Electric for $29,000 for electrical construction for the boiler blowdown rerouting project. Now therefore it be resolved that the County of Northampton does hereby concur with recommendation of the county exec as set forth in the attached document to be approved a contract by Elliott Lewis and Bellatar Electric.
Thank you. This was discussed yesterday at the
Yeah.
Finance Committee. Had an interesting description of what a boiler blowdown is. And as there's no other discussion, we can call for the vote.
Mr. Myers.
Yes.
Mr. Kuzic.
Yes.
Mr. Giovanni.
Yes.
Mr. Gofredo.
Yes.
Mr. Heckman.
Yes.
Mr. Lot.
Yes.
Ms. Fargo Hefner.
Yes.
Ms. Zirinsky.
Yes.
Mr. Brown.
Yes.
Adopted by a vote of 9-0.
Thanks. Next, we have GD Correction Systems LLC. Mr. Lot, will you introduce this resolution?
Sure, whereas on May 2nd,
Mike.
excuse me. Sure, whereas on May 2nd, 2022, Northampton County Council received a request from the county executive for county council to adopt a resolution approving a contract for a term of 4 years with an optional 3-year renewal with GD Correctional Services LLC in the amount determined by the service provided and the number of inmate meals and staff dining per the rate sheet in the proposal. The 2017 contract total paid to date is $5,100,000. Now, therefore, it be resolved that the Northampton County Council does hereby concur with the recommendations of the county exec as set forth in the attached document to approve a contract with GD Correctional Services LLC. So introduced, this was discussed at yesterday's committee meetings.
Thank you. Are there any questions? Yes, sir.
No question, but just a comment. I think for me, I'm just uncomfortable approving a contract of this size and for this length of time where there was only one bidder. So, I mean, I would rather see this go out for another bid to see if there were any other competitive bids because to me, again, I'm sure that the food will be fine and everything will work out. They've been doing a decent job, but 7 years, $5 million, that's cheap for a shortstop, but it's a lot of money in county government. So I won't be supporting this simply because of those reasons.
I did have a question regarding, I believe it would probably be Mr. Barron, regarding the extension. How does that come into play? Because it's a contract for 3 with the option to renew. So is there a timeline on that, or what's the process on that?
I would just, I'll turn the microphone over to Mr. Barron in a second, but I would just to reflect upon Mr. Cusick's comment, we're feeding over 600 people annually. So that gets really expensive, and there are only a few, as you heard last night at the committee meeting, there are only a few businesses that do this work, and no one bid against them in this process. So it is expensive to feed people.
Did you hear my question?
I did hear your question. So the way the process works is you are authorizing essentially the 4 years with the option to renew. The option to renew in the contract resides with the county executive. So you approve the option to renew for the county executive, whoever he, she may be, after the end of 4 years on this contract. And then that's the option. Like the IT contract, several contracts we have with the county.
I only ask because I think I didn't understand the IT one, and I didn't understand if it was automatic, it was something that council had to do, like you just clarified that for me, so thank you. Or if that's different contract to contract, so that's.
It depends on the service bid, but you also have to remember the county has a 30-day out in all their contracts, written 30-day out for any contract.
Okay, Mr. Myers.
My memory serves correct from that meeting from last night. Also included in this would be increases in salary for the people that they employ.
That was discussed.
And I am
Wasn't
correct,
clarified,
that was part of that
discussed.
plan. Was that not correct?
That's what I heard.
Therefore, it also includes that they're feeding in an increase of people if the minimum wage goes up. So that's why I don't have a problem with it, because that was explained last night. There's money included that's actually going to the workers, which is, we all are in favor of.
Okay. Any other questions, comments?
I guess my one
I'm sorry, I
question, I
didn't
know the principals are here, Mr. Coster's here. I, like Mr. Cusick, I'm not a fan of long contracts, and not when many people bid, but I do understand what the executive said. When you have certain specific services, you have very limited companies out there. I'm guessing that this 4 years plus the 3-year extension, if so desired, may have played into the cost we got right up front for the food, in that they know there's a certain stability in the contract, at least for 4 years. And if they want to get the extension, they want to work as hard as they can to keep the stability of cost. I mean, is that wishful thinking, or?
No, I think you're absolutely right. That's one factor, but for us, from the county's perspective, which is what we care about, this type of institutional feeding of up to 1,000 people, depending on our population at the time, is not the kind of thing we would get out of without doing another request for proposal. So we might get to the end of the 4 years, council might say, let's look at that again. It's really expensive. Let's go back out, but we'd probably want to do that extension anyway until we could get everybody, get it back out again.
And if I'm not mistaken.
So that's what from the county's perspective, that's the reason.
Well, also from the county, the contract has a built-in cost of living factor.
Yes,
For the.
it does.
They have, okay.
Yeah,
No
it
problem.
does.
Mr. Gafredo?
I agree with what Mr. Cusick's saying as far as, $5.1 million. I understand it's a lot of people to feed, but that number is not really pinned off of anything, because we don't have any basis of, comparing it to anything. But unfortunately, the number's out there now, so we can't ask for any other bids because they can just undercut the bidder. But I would say that we are committing to a 4-year contract when food, cost of labor, cost of everything is at all-time highs. Is there any chance that we could do a shorter contract, and then next time around, hopefully maybe get lower numbers, more bidders, and lock in for potentially a lower rate when things can come back to reality?
That's a question for them.
Wait a second.
Or-
Is this 5.1?
Or is that just a comment, or are you asking like?
It's a question for them, but comment in general.
The way I understand this to be read, the $5,100,000 was from the 2017 contract, total paid to date. So that was not the current bid. So I don't know if I misunderstood you, John, but we didn't let the cat out of the bag. That's what we normally pay. Is that correct, number one? Number two, at the committee meeting, I believe they said there's basically 3 companies. It was a handful of companies of that. And sometimes it's not that unusual when you have such a specialty service, when you have so few people that provide that service. And the way the principal explained it, if I remember correctly, they tend to stay away from people that they don't think they can win the bid against, because it costs a lot of money to bid something like this. So they tend to, this is what I got from the committee meeting, they tend to stay away from bidding against it. So we may end up being right back where we were. And a lot of times, I dealt with a lot of contracts in my prior business, and there was a real value to longer contracts for the stability on our part. So I will be supporting this, and I just, because of what I heard yesterday. Thank you.
I can answer both questions. The first is, there are so few people who do it because you need a specialty license. The facility that we run is licensed by the Department of Corrections. There are only certain companies that meet the standards that are even allowed to bid to bring food into an institution of that type. That's the first thing. The second thing is, if you read the contract escalators are tied to the consumer price index. So Mr. Graffredo's concern, if the cost of food comes down, the CPI will also come down. That being the case, we will pay less money for the food. So the 4-year term is really to make sure we have some stability in the home. And as Mr. Costora reminded me, that the real way to make people upset in a jail is to not have food.
Mr.
So yesterday, he also said that there was, I believe he said there was a 30% increase in food costs?
Yes.
Is that correct? Yeah, so if you break down $5.1 million, 365 days a year for the 600 residents that live there, that's $23.28 a day. For 3 meals. I don't know if I could feed my family 3 meals a day for $23.28. So I think we're doing all right. And I'm going to agree with this. Am I correct?
You can't.
Yes, please do.
Yes, come.
Yeah, we're not a
You
court.
got to come to the podium.
You have to come to the.
You have, when you come up to the mic, just say your name again, please.
Casey Jefferson with GD Correctional Food Service. Yes, our food prices have increased by 30% over the last 3 years. Our employees' hourly wage is $14.84. It's our average hourly employee wage, which is a lot higher than minimum wage for anywhere around this area. Our managers make a lot more than that too, but that's what our average wage is. The amount per meal is actually $2.05 a meal. So we get $6.15 per day to feed each inmate, all 3 meals, not $23 a day.
But I mean, that's the cost for the day, for the workers, overhead, everything.
Yeah,
Soup
$6
to nuts.
Soup to nuts,
You
$6.05.
have $23.28. If you went out to a restaurant, you might get a fair meal for $23 for 1 meal.
Right.
But I'm just saying, we know that we have to pay workers. We know that this isn't just about food costs. And we definitely want the people in our prison population to be fed fairly. And we want to make sure it's good nutrition and that they are treated humanely. I think $23.28 a day is more than we could ask for on a budget.
I will say one more thing, just so you know, there were 3 bidders that showed up at the pre-bid, did the walkthrough, asked a lot of questions about the bid, but we were the only ones that submitted a bid. So they had the option to do it, they chose not to. Sure.
Sure.
How typical is that you go to a pre-bid, there's 3 competitors there, and 1 bids?
It depends, sometimes we're the ones that don't bid.
Sure, so I'm
Depending
saying,
upon,
is that
depends on,
pretty
we have
standard
been here for a
range?
while, we have a great relationship with the county. They like us, we like them, we'd like to stay here. We put in a competitive bid to stay here. But it does happen, it does happen. I was talking to the director before, I told him we just bid on Dauphin County. There were 3 bidders there. We were a little bit higher than the lowest bidder, so we did not retain the business. We didn't get the bid.
Mr. Brown?
For the 5.1 million that has been spent, what does that translate to per meal?
You just said $2.
Price per meal used to be $1.51
All right, so
when
it
the
was-
original bid went out.
That was at $1.51. And
Correct.
the bid now is at $2.
$2.05.
$2.05. Okay,
Yes, sir.
thank you.
You're welcome.
May I just add that I think $2.05 is almost equivalent to like what it costs a child at school for a school lunch? Is that almost accurate? I mean, I think I give my son $3 for lunch. So
he's a
I think this
growing
is, he's growing, I get it.
My wife
I think
gets
this is
me
pretty fair. I'm going to vote for this.
Mr. Heckman just announced that he gets 5 a day, too.
$5.
I hear what my colleagues are saying, and I agree with my colleagues, but I also hear Mr. Cusick's concern, which he also raised yesterday. I think we did address that we would be addressing the procurement process or the bid process at a future Finance Committee meeting. So I think, rather than hanging out your company, but I appreciate your willingness to discuss the process as you see it within your industry. So thank you for that. Any other comments, points? Quiet man? No? Call for the vote.
Mr. Lott,
Yes.
Mr. Giovanni,
Yes.
Mr. Gofredo,
Yes.
Mr. Heckman,
Yes.
Mr. Myers,
Yes.
Ms. Fargo Hefner.
Yes.
Ms. Zirinsky,
Yes.
Mr. Brown,
Yes,
Mr. Kuzic.
No.
Adopted by a vote of 8-1.
Thank you. Next, we have Vision Technologies. Mr. Giovanni, will you introduce this resolution?
Yes, I will. Yes, ma'am. Yes, ma'am.
Whereas on April 26, 2022, the Northampton County Council received a request from the county executive for county council to adopt a resolution approving a contract in the estimated amount of $144,644.53 with Vision Technologies for hardware for the disaster recovery refresh. Now therefore be it resolved that the Northampton County Council does hereby concur with the recommendations of the county executive as set forth in the attached documentation to approve a contract with Vision Technologies.
Thank you. Any discussion regarding this matter? Call for the vote.
Mr. Giovanni,
Yes.
Mr. Brown. Yes. Mr. Kuzic,
Yes.
Mr. Gofredo,
Yes.
Mr. Heckman.
Yes.
Mr. Lott.
Yes.
Mr. Myers.
Yes.
Ms. Fargo Hefner.
Yes.
Ms. Zirinsky. Adopted by a vote of 9-0.
Thank you. Next, we have the consideration of an amendment to the Administrative Code, Article 13, Contract PennDOT. Mr. Gofredo, will you introduce this resolution?
Whereas on January 24th, 2019, the Northampton County Council adopted Resolution 14-2019 endorsing a contract with Pennsylvania Department of Transportation for preliminary engineering for Bridge 15, Meadow Road, in the amount of $450,000, of which 80% was federally funded and 20% was county funded, with construction anticipated to begin in 2024. Whereas on May 5th, 2022, the Northampton County Council received a request from the county executive for county council to adopt a resolution approving an amendment to the contract with PennDOT to increase total expenditure to $715,433.63, of which 80% is federally funded and 20% is county funded, to allow for the fast track of the demolition of the bridge while the engineering for the eventual replacement is ongoing due to the hazardous safety condition of the existing structure. Now, therefore be resolved that the Northampton County Council does hereby concur with the recommendation of the county executive as set forth in the attached documentation to approve the contract amendment.
Thank you. Any further discussion regarding this matter? Yes, Mr. Meyer?
This was discussed yesterday at the capital budget, and we can see that there's an increase because things have gone up. But one thing's positive is the damn bridge is coming down.
Any other discussion? Call for the vote.
Mr. Gofredo,
Yes.
Mr. Kuzic,
Yes.
Mr. Giovanni,
Yes.
Mr. Heckman.
Yes.
Mr. Lott,
Yes.
Mr. Myers.
Yes.
Ms. Fargo Hefner.
Yes.
Ms. Zirinsky, Mr. Brown.
yes.
Adopted by a vote of 9-0.
Thank you. Next, we have the consideration of American Rescue Plan funding for capital projects resolution. Mr. Myers, will you read this, please?
Whereas The citizens of Northampton County will benefit from these health and safety improvements within Northampton County facility. Now therefore be resolved that Northampton County hereby authorize the county executive to engage in the following capital improvements. Number one, to allocate $2.5 million to the prison D-tier project. Two, to allocate $425,000 to modernizing the elevator in the government center.
Thank you. Is there any discussion regarding this matter? Call for the vote.
Mr. Myers?
Yes.
Mr. Giovanni?
Yes.
Mr. Gofredo?
Yes.
Mr. Heckman?
Yes.
Mr. Lot?
Yes.
Ms. Fargo Hefner?
Yes.
Ms. Zirinsky? Yes. Mr. Brown?
Yes.
Mr. Kuzic?
Yes.
Adopted by a vote of 9-0.
Thank you. Next, we have the consideration of American Rescue Plan funding for technological improvements resolution. Mr. Giovanni, will you read this resolution?
Yes, I will, ma'am. Whereas American Rescue Plan funding does focus on technology to increase the safety of citizens during this global pandemic. Now therefore be resolved that the County of Northampton hereby authorize the county executive to engage in the following technology projects. Number one, the allocation of $1,485,000 on scanning and indexing paper documents. Number two, allocation of $150,000 for broadband development, focus on creating access. Number three, the allocation of $140,000 to purchase a high-speed tabulator for the election division.
Thank you. Is there any discussion regarding this matter? Mr. Giovanni?
I'd like to make a motion to have these three allocations voted on separately.
Okay, just what's my procedure for doing it?
Second.
Can I have a second on that?
I'll second it. I don't mind voting on them separately.
Thank you. Call for the vote. Just give her a second. So we'll just vote on all three. Do we need to vote on the motion to separate?
Vote.
Yes.
With the- Are you ready for the? Okay, go ahead.
Well, discussion,
Oh, do we need discussion on the motion? I apologize.
if anybody has it. I just want to say, Mr. Giovanni has always been very competent when I've gone to him with issues. And if he has a reason to do this, I'm fine with it, so I'll be supporting it.
Call for the vote on the motion.
Mr. Giovanni?
Yes.
Mr. Kuzic?
Yes.
Mr. Brown?
Yes.
Mr. Gofredo?
Yes.
Mr. Heckman?
Yes.
Mr. Lot?
Yes.
Mr. Myers?
Yes.
Ms. Fargo Hefner?
Yes.
Ms. Zirinsky?
Yes.
The motion passes by a vote of 9-0.
Thank you. Next, we will take each one separately. So first, we will vote on the allocation of $1,485,000 on scanning and indexing paper documents. Any discussion on that matter? Yes, sir.
I have a question for Mr. Barron. So yesterday at the committee meeting, somebody asked the question, aren't we already scanning and indexing the paper documents currently? And I believe you said yes, but this would speed up the process. Can you just explain that a little bit more? Will these documents eventually get scanned and indexed just in a longer period of time? Or?
Well, we are severely running out of space in the archives building. We have records that are over at Gracedown, Gracedown records over there, taking up a whole bunch of space at our permanent retention. This will allow us to scan a lot of those documents and allow us to have access to them as they go over for long-term residents of Gracedown to be able to get them back and forth rather quickly. It will also allow us to have better access to the more historical records that the Recorders of Deeds office use. Some of those records still have yet to be scanned. We also have a lot of paper around the building that we need to scan that can't go over to the archives. In the fiscal department specifically, I have boxes that take up entire walls that we need to scan. And if we're able to scan those documents, we'll be able to access them much quicker for the public when they come in for their assessments and things like that.
My question is that we are currently doing that, right?
We are doing that, correct, but not at the pace we need to.
So it's
If I may, having dealt with that directly at the archives, we are scanning backwards and forwards, and we are scanning from 1930 forward, and then dealing with the active cases backwards. So when you look at, quite frankly, the history of Northampton County, this is something that has only really begun in earnest, perhaps in the last 5 or so years. So this is not something that's really been a large focus. So although we are doing this in time, this gives us an opportunity to make this investment now so that this information is available to the public more directly. And we were at one point 2 years ago in danger of filling the archives building. So this brings us out of that danger and allows us to take things that don't need to be in permanent retention out of the building and makes them much more accessible.
And one last question. How much time do you think this would save if you take from standard to the expedited process? How much time are we saving scanning all these documents?
It's not necessarily time as much as it's the documents that we can get to. This would allow us, we have 4 people working at the archives office now to scan any series of documents. I would scan one of the documents, you would have to quality control it, and then it would go into permanent retention to meet the PMHC requirements. Reynolds can do this in a matter of days for what would take us weeks and months, and we wouldn't get to it, they will get to it.
Thank you.
Ms. Zirinsky?
Well, my question was similar to Mr. Gofredo's, because I think what he's suggesting is that if the process itself is just being shortened, if we didn't agree to this allocation, how long of a duration would we be looking at? Like how much?
It would be likely that many of the documents that we're looking to, that this money infusion would take care of, would never get scanned.
So it's the difference between being able to scan the documents and not being able to scan the documents. It's not just an efficiency issue.
It's not simply the efficiency element that Mr. Barron brings to attention is the efficiency in getting the documents back and forth from archives to here to help people do the work that this building does. But the ability to scan those documents, to protect those documents, to put them into the PMHC retrieval circumstances, it just wouldn't get done.
So we are currently scanning documents.
We are, when we have when document purchases or document-related activities take place, we are given money towards that end. So as we get money, we put money towards that effort. But it's never enough to catch up on the 100 years of documents that we have not addressed.
Right, so this allocation represents us trying to catch up with the workload that we already understand is almost insurmountable.
Yeah.
Yeah, okay, thank you.
Mr. Myers?
Just to follow up on this, Mr. Barron yesterday made a statement that there are records that we have people who did not want to give up documents and their financial issues. So it's like, this will make it a lot faster for us to look up something by scanning this. So I don't understand what the big discussion's about.
Yeah, it will. And Mr. Barron's point that I guess he didn't necessarily make is that we didn't have a working system up until recently. So for those folks to give up their documents for a system that wasn't working was a very hard sell. It was important for us to prove to everyone that this was going to work as it should, and it has been.
That's clarity I needed. Thank you.
Mr. Heckman?
Yeah, I just need a little more clarity. I plan to support it, but I mean, I'm hearing a lot about the car, and that's great, but I'm just curious, what specifically are we buying with this money? I mean, I know what the objective is.
Sure.
How are you going to make that objective happen?
We have, as I said, we have 4 folks at Archives doing this work. We also have some people working in civil, criminal, and the like doing that work. Some areas have done great in all of that. This would be to contract this work out so that it wouldn't be tying up our employees on this, to give it to scanning professionals, as it were, to get this, to run through this work. As many of you, Mr. Heckman, you clearly have been down to the deeds office. When you looked in that office, there were hundreds, if not thousands, of deed books.
Right.
That would take Northampton County staff years, if not decades, to get through.
Right, and
We're finished with it already.
I appreciate it.
So
I mean,
that's kind of the size and scope of what you're getting.
Right, and we hear a lot about why we need to do something and why it's
Sure.
great. But I wanted to specifically, and because I wasn't sure, are we buying another machine?
No.
So this is going to ultimately be a contract you're going to let
Yes.
for that amount of money for someone to come in and do this, or go out
Yes.
and do it. Fair enough, thank you. That's what I wanted to find out.
Mr. Brown?
This is then for the contractor doing the scanning. With each scan, though, we eat up storage capacity, so has the administration allowed for additional servers over time as you?
Yes.
Continue.
Yeah, that is something that we continue to focus on, both in our disaster recovery as well as our day in and day out. Yes, absolutely.
So then the actual amount is being used to contract with the company to do this process. Am I correct in that?
Yes.
Is that all?
Well, it works for our folks as well because our folks are part of that process. So it works with our folks as well. So this is a broad scope, getting as much documentation scanned as we can in a reasonable amount of time.
Mr. Cusick?
First things first, PHMC, could you tell the folks at home who don't know
I'm
the
sorry.
acronym what that is?
My apologies. Pennsylvania Museum and Historical Commission. I had to get the C there.
Okay.
And they are the ones who set the standards as to what allows us. For the longest time, they did not allow electronic scanning. We had, as some people remember, microfiche, microfilm. That's the only thing that were allowed. Northampton County, back in my days on county council, fought and scraped to get to a digital answer. They never allowed. We continued to do microfilm at that point, and now that this is available, it takes up significantly less room and is much more accessible.
Yeah, and I guess you had already mentioned a company. Would this be a competitive bid situation, or why or why not?
This is a state contract that we work with that company with. We've worked with other companies and have not had great results. So this is just continuing a project that we've been doing. This just gives us an opportunity to do more of that project in a short amount of time.
Thank you, I get it.
Any other
And
comments
more
or
importantly,
questions?
they are in Allentown.
Oh, but we still have, and we're not messing, we're such an old county, some of those historical documents, and those are preserved and.
Items of permanent retention stay in permanent retention, yes.
Yeah, I mean, I think people would be amazed at some of the documents Northampton County is in possession of.
But much to your point last night of goldenrod, pink, and white copies.
That's not one of the things I'm referring.
We do in fact save all three of those at the archives, and there is no reason for that. And one of the ways to address that is to go through and scan what we have and get rid of the triplicate.
I agree. I was already told how old I must be to talk about something like goldenrod copies, but it is truth. And
Unfortunately, those are still current.
yeah, I agree.
Are there any other questions or comments? Let's call for the vote.
Mr. Giovanni.
Yes.
Mr. Kuzic.
Yes.
Mr. Gofredo.
Yes.
Mr. Heckman.
Yes.
Mr. Lot.
Yes.
Mr. Meyer.
Yes.
Ms. Fargo Hefner.
Yes.
Ms. Zirinsky.
Yes.
Mr. Brown.
Yes.
Adopted by a vote of 9-0.
Next, we have the allocation of $150,000 for broadband development focused on creating access. Is there any question or discussion regarding this matter? Mr. Giovanni?
Is Tina here?
She is.
Tina Smith? Hey, Tina. I have a couple questions. I have a couple questions. This $150,000 is for a study for broadband,
Correct.
correct? Okay. And the federal government, with their infrastructure, set aside $45 billion for broadband.
Yes.
Okay. And why will we not take the grant money from that for this study?
We have no idea what our allocation will be, if any.
I think Miss Susan Wild ought to look at that.
Believe me, we've been asking. I've been in touch with her office regularly. There's still no information
Okay.
out about that.
My next question is, you have talked to some internet service providers, which is ISPs. And from talking to them, you said their infrastructure for the broadband would be closer to $2 million, is that correct?
The one estimate we had for a specific area, yes.
Okay. With this study, I don't think you can get any better than that, from my experience.
We don't know.
Well, I can tell you, I will talk to ISPs every week. The problem being is, and I don't want to, the rural areas are a problem. And Ms. Zirinsky's going to smile, and so is Mr. Lamont, and McClure. The problem is with the rural areas, preserved land, and Act 399 preserved. So you have the preserved land, and you got a gentleman living, or somebody living in a farmhouse on that preserved land. But he needs internet access. So the construction of infrastructure to get that person internet access, the ISP's return on investment is not very good because you only got to give it to one guy. So they're going to come in high. I deal with a problem all the time. People call, hey, I want to be a remote worker, and we need to set you up. What kind of internet service you have? Frontier, 13 meg is an issue. So, I mean, for them to build their infrastructure for broadband is going to be very expensive. It always is. So what I would recommend, at least I'm not going to vote for this because I think that 150,000 should go back to our federal government, and they got to put the pressure on ISPs to make that happen. That's my concern.
Yeah, I mean, hopefully they will. The only thing I could, possibly add is that this is not going to just look at the feasibility of trying to get broadband to the areas that currently don't have it. It's how do we get the most affordable option out there to the families that can access it, but not necessarily afford it.
Correct. And I agree with you, but come 2030, there's going to be more remote workers than the paradigm shift is going to happen. There's going to be more remote workers, more needs for the internet service.
Right.
And I think that's going to play a major factor also.
Yeah, I don't disagree, and that's why we've got the hospital networks and the cities involved in these discussions.
Yeah. But the cities are easy because the infrastructure is not hard to do for the cities.
Well,
It's the rurals that are the problem.
I disagree respectfully because the cities are at the table because they are focusing on the same issues that the county is.
That is true. But again, I think it's the rules that the federal government are making that aren't cracking down on ISPs. They're going to spend $45 billion, and I'll be honest with you, I'm going to be on their behind because a lot of times I'll talk to people, I want to work remotely, but I can't get the internet access. Now, in the cities, it's not too much a problem because we have a lot of vendors that you can pull from. But out in the rurals, there is not very many. So I think that's going to be a problem.
Well, I guess, that remains to be determined. I do know that, Service Electric was working with Plainfield Township and found that surprisingly, it's not as big of an impact in that specific area as you would think. So that's the report that we were given.
Ms. Zirinsky, do you have a question?
Yeah. It's my understanding that broadband access is one of the major problems in Pennsylvania, not just in rural areas, but in lots of different areas. And as someone who does the solar energy consultation, we need people to have Wi-Fi access to be able to monitor. So I know in rural areas, sometimes people can't have that kind of energy because you can't monitor it, and that's a requirement. What I don't understand about your issue is, why can't we do both? Why can't we have the study and pressure Congress to make the allocation to have better broadband? Because it is such an issue, and we need answers in our county that are specific to our county that might not be addressed by any allocations of the money and funds that you're suggesting. I think this study would be valuable to understand how it is that people access, what are the barriers to their access, and how is it that we can help them overcome those barriers that are specific to our locality.
Right, and so what the RFP would be is we're going to try to find that firm to bid who would have the expertise and support to bring the recommendations with the study on how to go ahead and obtain the high-speed fiber networks and provide the services to the folks that are currently lacking, whether it be from an affordability aspect or an accessibility aspect.
Right, and I think the affordability aspect is really important too, because I know that there are students, not just in elementary, like K through 12, but also students trying to access online classes at the college level. You know, they're going to McDonald's to do their assignments and their homework rather than at home or wherever they live, because they don't have access and they don't have Wi-Fi. And that is something that we need to understand is how are people using it? How are they affected by their region and the development around them? And why aren't they able to access it in their areas? I think I think this is a valuable study, and I'll be voting for it. Thank you.
And I just want to add on to that, you are correct, because Northampton Community College is also one of the entities that are involved in these meetings, and they're seeing the struggles that their students have.
Yeah, those are my students.
Right.
Mr. Heckman?
Yeah, I have a question, a couple. One is, do we have a company that we already know that we wanted to have do this study?
Not necessarily, that's why we'll put it out to bid, although there's a company called LIT, L-I-T, that did a similar study for York County that you can look up.
Okay, the next comment I'd have is, I expand on what I said yesterday. I think we also have to be aware that, because I agree with what Mr. Giovanni's saying, that our county is so diverse, there are dead spots that are just going to be a challenge. I mean, we can go back to the 911 wars, and that was an issue, despite all the modern technology that was being brought in, of getting certain areas, particularly in the Slate Belt, because of some of the mountainous regions. I mean, there were just dead spots, and it took a long time to get that tech worked out. But that is a county responsibility. It was, and eventually we passed it. Some of the concern I have with this is, and this reminds me somewhat of when we had Health Bureau talks, you said people like the community college come to the table, school districts, the cities. Oftentimes, these things come down to who's willing to pick up the tab. You got 6 people at the table. School districts oftentimes say, oh my God, we can't afford that. Look what we have to spend. Cities are notorious for trying to give it to the county. And so I guess my concern is, just like with the hospitals, when we were talking health bureaus, when we got down to the nitty gritty of, okay, we're all on board, so we need a little bit, oh no, we give advice, but we don't give money. So I guess what I'm saying is, there are people in the city or in urban or more urban areas who don't have it, not because they can't afford it, because they just don't want to spend the money. So I guess it comes down then to an argument of, or a discussion at least of, should I subsidize somebody who just doesn't want to spend the money so they force their kid to go to McDonald's or go to the library, or shouldn't I? And we can get into the morality of doing that, but it is a legitimate issue to discuss as to if you get away from it's the right thing to do, but there are a lot of right things to do. I mean, when we had the discussion about 911 fees, people would come up and yell at us because you won't do it, and you don't care about lives. And I said, well, we could afford to put an EMT on every street corner. Are you willing to pay the taxes to do that? And of course, nobody wanted to talk about that because we do put a price on everything, no matter who we are. So I guess my concern is, I just don't know if this study, first of all, we should send something to Susan Wild. Have they passed that, or is that still under discussion?
It's passed.
So,
We just
who's
don't
making
know
the determination?
how they are making the allocations, and
Who's making the allocations?
we don't know.
Well, I think, oh, okay. I mean, I would think, I'd like to know.
We don't know if the state's making it or if we are just getting X amount
Well,
of
I'd feel
dollars
more
as our own
comfortable
allocation
once
from the
we know.
county.
I certainly would feel more comfortable. I think if they're not going to tell us,
I don't think they can tell us because it hasn't come down from the federal government yet.
No, well, the feds then should tell us.
Well,
We elect
yeah.
senators, we elect state congresspeople. I don't know, they should do more than make speeches. I'm sorry, I'm finished.
I'd like to go at this time. I had a little bit of a question about this yesterday because I just received information yesterday that there's a federal grant specifically to do this. And so I asked, Mr. Barron gave me one answer, and then I did a little more research, and it says there's $1 billion available through this program to, intended to reduce the cost of bringing high-speed internet to unserved and underserved communities. There's a program there's on May 24th, there's a forum. On May 26th, there's a forum. And so I know what you're talking about. We don't know what our infrastructure allocation is, but this is separate money that's been delegated to this region that we could apply for. So my concern is, again, why are we rushing to get this money out the door? I'm not opposed to broadband development at all. I'm happy to do so. But I personally would like to wait a little bit, see if you could apply to them for this money and then use the $150,000 somewhere else. Because it's not, my concern with a lot of these projects is not what the projects are. You know, we're making it like, oh my God, you're against broadband. No, I'm totally for broadband, but it's ARP money that we're discussing, and it's a specific pot of money that we only get one more time, and how do we want to allocate that? And so if there's money over here that we could keep this for ourselves and use it for another project, I don't see why we can't wait until maybe somebody goes to that seminar and finds out what that's about. So that's my question about the whole thing and my concern, and I don't want to say no. I'm always happy to table and defer something so that you could get the information, come back and say, here's, we do qualify, or no, we don't, and then say yes in 2 weeks. So that's my 2 cents. Thank you very much.
The thing is, we could get $2 million tomorrow, but what are we going to do with it? And this study is going to direct us on how we best spend whatever that allocation is. Right now, we don't know.
Sure,
We're going in
Be able to get the
circles.
study money from the grant is my point, and we don't know.
No,
Because nobody's gone to this thing to see what it is, because the seminar hasn't been had yet. I'm sorry, Mr. Lott and then Ms. Zirinsky.
Can I?
Mr. Lott, then Ms. Zirinsky.
That's fine.
Ms. Smith kind of answered my question.
I'm sorry.
But my question was, this study, because I'm not real clear on exactly what we're studying, but, you know, I did listen last night, but anyway, would this study apply to the money that we get from the infrastructure bill? I mean, I think I just heard you say this is what we'd use.
Yes.
So you're taking some federal money to do the study, and then we take the other
That we
federal
have a
money to
plan for
develop
when
it. So
we-
you're really looking at this for the infrastructure money as a study for that. I think that changes it for me a little bit, because if we're doing a study and it's only going to apply to the study, and then we got to figure out where the money comes from. But if this is going to be a study that's going to help us use that infrastructure money, you know, that I can understand.
If
Thank you.
we get one round, so if we don't have a plan to spend the money, we can't spit in the wind to get the money. So if we have a plan that's done by a professional company, and we have a need to direct 2 million, 3 million, whatever that number is, we're able to ask for it from infrastructure money and get it. If we delay, we get no money, or we get at the end of the line.
But that's conjecture. No, I'm just saying.
Yeah, so I thought that was a good point that you made about those seminars that are available, but I think my question was kind of answered. So often, though, we are not prepared as a county for the funds that we could receive. And this is actually preparing us and anticipating our own needs for the money that's going to be available in the future. I actually think that that's a great idea, because we're not going to be caught off guard. We're going to be prepared. And I just can't wrap my head around delaying this if we understand what we need, we understand the future allocations that are possible, and this study is actually going to get us there.
Correct.
Okay. Thank you.
Mr. Myers.
I've listened to everybody up here and reasons for yes, no, or whatever. I just have one thought in my mind, and it's about education. And so many folks, whether they're in the city or in the country, that don't have broadband are going to be lacking in getting what they need. I hear Mr. T, Mr. G talk about it, and I understand, but now I understand your point of view that for once we'll look like we're going to be in front of the game instead of behind the game. And that is what the common sense needs to come at this point. Anytime we can be proactive, we need to be proactive, not reactive.
Correct.
So from that standpoint, if we're trying to be proactive and we can take care, and I want to make sure every child that's in Northampton County has access to broadband, I will go along with this.
I just have one last question.
Sure.
Tina, you mentioned all the people at the table, school districts, city, some
Correct.
townships.
Correct.
Have any of them been willing to throw any money or match or anything like that?
I don't necessarily, I wouldn't say that they're unwilling, because specifically the city of Bethlehem and Easton have their own ARP allotment of funds. So, you know, quite frankly, once the study comes out and makes the recommendation and we assess the price tags, yeah, we're going to be asking everybody at the table
All right,
to be willing to contribute if
I
need be.
appreciate that. That's after the fact. And I know, I don't want to be prickly. My questions sometimes are very specific, and people go.
No, we did
"They're
not ask for
helping
funding
with
for,
this
no,
study."
no.
So it's all on the county again.
That's correct,
City
all
of Bethlehem
150,000.
They get ARP money. The city of Easton isn't. They get ARP money.
No, we did not ask
Okay.
them to contribute for
We
this.
didn't ask
We
them.
did- we
Why
did
not? I'm just,
Because
think
the
that-
county wants to take the lead on this. We've been taking the lead on this since the pandemic with our voucher program.
okay. Well, no, if you don't ask, you won't get. And I guess I think especially the cities irritate me because they have money. And some of these townships, I mean, they don't want to have a tax increase 5 years, 6 years, 7 years in a row, and they brag to their citizens they don't do it. One reason they don't have to do it is because they lean on the county or on somebody else. So I've always been about that for many, many years. I think sometimes we're too nice. And we get taken advantage of because everybody will sit at the table and they'll all have ideas. But when it's time to pay the tab, as I like to say, you look around because the exit doors are still swinging. So I don't disagree with what you want to do. Don't get me wrong. I'm just, Ms. Hefner brought up these meetings that are going to happen. Mr. Giovanni. After hearing all of this, thank you, Tina. I mean, where are you at on this? Because you've heard what everybody has said since you brought this up.
My point on the whole situation was infrastructure's been an issue for how many years? Decades. All of a sudden now, Biden and Harris put a plan together. Administration, hey, we're going to kick in $45 billion, for broadband, and now we're going to use $150,000 of rescue money to do a study. To me, I would, get the money from them to do a study. Or,
Okay.
the town, I agree, I heard what you're saying. I live in Plainfield Township. When I moved into my development, I had to use Service Electric. Guess what? I'm on Down now because I get a better speed than the Service Electric. There's people that don't have those arrangements or can make those decisions. And it's an ongoing issue. It's going to be an ongoing issue after you do the study. I mean, it's an ongoing issue for us every day. It's companies want to get out there and be on the broadband and they want to work from home. The kids want to do the education. No doubt about it. It involves everybody. I understand that. But I just think $150,000 of ARP money is not what we should do to do the study.
Mr. Brown had a question.
Hi, Tina.
Hi.
You mentioned there's one company that you're aware of that did a study like this in York. Have you reached out to the Office of Technology at the state? I think it's the Office of Technology and Innovation. This has been a central point within the state, often monies for broadband, and they focus very specifically on the very problem you're talking about trying to solve locally. So if you haven't, I would reach out to them as a resource. Over the past several years, I know different parts of the state, especially central PA, northern, even up into Scranton, definitely up in Erie, have had to come up with very different approaches to address the very matter that you're trying to address here in the county. So if you haven't reached out, it may give you background and context to help scope the kind of study that you'd like to have done here and give you a preview of some of the solutions that different regions have tried to implement. I won't disagree with the comments here. It's technology, broadband, it's going to be expensive no matter what.
Sure.
But I do agree with Mr. Barron that depending on how the monies get channeled, and it's probably, this office is probably going to be part of that funnel. It'll come to the state, and the state will then either be the intermediary or, probably not direct, but an intermediary to put some parameters on this. So getting to know them, I think, would be helpful for the county to have an access and a voice and some resources. But to Mr. Barron's point, when and if the money comes, you have to have almost a shovel-ready plan in place, because it's probably going to be competitive. I don't know if with the 45 billion, Tom, that you read, if that's going to be, everyone's going to get $1 and that's it, or it's going to be, we're going to fund the top 5 or 10 most competitive options.
right.
And you have to have those as shovel ready. So just some insight to help guide what you're doing, and I'll support it because I do believe you have to be ready to do it. But there's more resources available if you reach out, and if you need some help with that, I'm happy to contribute.
Thank you, Mr. Brown.
Mr.
If
Heckman?
I can, just very briefly, so much of what has been said by council tonight, even folks who have differing opinions, I think I've said at one time or another, Mr. Brown hits it on the head. My fear, I'm not a big fan of studies. My fear, though, is that we're going to get $20 or $25 million handed to us. It will be the county's responsibility, and we will not be prepared to spend that money. We won't know where there's a lack of access due to a lack of infrastructure. We won't know where the people are living who can't access it because they can't afford to. Think of it sort of as akin to all the other studies we do. The cultural asset study, the study on affordable housing, all those census tract data we get so that we know where the needs are. This study, I believe, done properly, will demonstrate to us where the needs are and what the various things are going to cost. If we need to do, to Mr. Giovanni's excellent point about rural broadband infrastructure, we may not be able to do it with $20 million. Right? But we don't know that. Or we may only be able to extend it, to a certain area. But even extending it to a certain area will be better than what we have today, but we don't know any of that. We know where we need affordable housing now. We know that because we've done those studies. We know where our historical and cultural assets are because we've done those studies. So I think that this is just that, a species of that, knowing where to go and how much things are going to cost.
Mr. Heckman had the floor.
Thank you for indulging me.
Tina, or you can add. I am leaning towards yes, but I will say for any regional project countywide, going forward in the future, we get this money, whatever happens, I really think that we've got to not just hear what these entities want or their needs. They have to put some skin in the game, as we'd say. I mean, I get it. There's regional and countywide, and counties seem to be becoming more. If we're going to be like the West, where the county is the small unit of government, then the townships are going to have to get rid of their boundaries and so on and so forth. But I mean, NACAC's got money. Lehigh's got money. And Lafayette, they've all got money. And if they're going to come to the table, I don't really need their advice on this. I mean, it's great to hear what they have to say, but I've always believed in the old sign above the bar, Bath Hotel. In God we trust, everybody else pays cash. And I trust in God. I don't trust in all these stakeholders who have these great ideas because, again, the county's picking up the tab. So I always respect what Mr. Giovanni says. I'm going to vote for this, but going forward, I just want you to know, no matter, even though it's a wonderful idea, I think putting a man on Mars is a wonderful idea. We always come down to what it's going to cost and how effective it will be. And, I just think everybody's got to share the financial burden sometimes. That's all. And so I just wanted that was my main issue. It's always been an issue for me. It goes back to Mr. Group. A lot of us saw the county become more and more powerful, but a lot of it's been, oh, you're willing to spend the money, you're willing. And I realize we're the ones receiving the funds. So I get that part too. But I hope if we end up the only one that can administer the funds, we can listen, but we set the rules.
Well, that's why we want it. That's why he or she who pays the piper calls the tune.
Mr. Cusick, did you have any comment? You're the only one who hasn't made a comment on this topic? Mr. Giovanni?
He's going to keep his head down.
It's the toughest $150,000
Okay,
tonight.
thank you. Call for the vote if there's no further discussion.
Mr. Giovanni.
No.
Mr. Gofredo.
No.
Mr. Heckman.
Yes.
Mr. Lott.
Yes.
Mr. Myers.
Yes.
Ms. Fargo Hefner.
No.
Ms. Zirinsky.
Yes.
Mr. Brown.
Yes.
Mr. Kuzic.
No.
Adopted by a vote of 5-4.
Thank you. Next, we have consideration of the American Rescue Plan funding for staff retention bonuses at Gracedown. Mr. Heckman, will you present the resolution? Oh, I'm so sorry. Sorry, I forgot number 3, the most important one, the allocation of $140,000 to purchase a high-speed tabulator for the Elections Division. I'm sorry. Is there any discussion? I'm sorry, you breathing? Okay, good. I apologize. I just thought we were moving on. Any discussion? I feel like we are fully aware of this one. So call for the vote.
Mr. Derringer told us we needed this.
Mr. Giovanni.
Yes.
Mr. Brown.
Yes.
Mr. Kuzic.
Yes.
Mr. Gofredo.
Yes.
Mr. Heckman. Mr. Lott.
Yes.
Mr. Myers.
Yes.
Ms. Fargo Hefner.
Yes.
Ms. Zirinsky.
Yes.
Adopted by a vote of 9-0.
Good. Then now we have the consideration of American Rescue Plan funding for staff retention bonuses at Gracedown. Mr. Heckman, will you introduce it, please? Staff retention.
Yeah, I'm looking, make sure I have the right one here. Staff retention, got it. All right. Wow. All right, I'm going to read this because the others that come after it, the prologue is pretty much the same, and I won't have to read all the others. When Steve broke this up, I think he used the same top parts. Whereas the county executive and county council have recognized the struggles of Gracedale, Northampton County's nursing home during this global pandemic, and whereas the Northampton County Executive has asked that $15.5 million of the next round of the American Rescue Plan Act funds be dedicated to saving Gracedale again, and whereas the Northampton County Council has expressed the need to provide financial incentives to keep and recruit new staff to the nursing home, and whereas there is a need in our long-term care facilities to encourage and recruit certified nursing assistants, licensed practical nurses, registered nurses, and support staff in Gracedale. Now therefore be it resolved that the Northampton County Council hereby authorizes the county executive to direct Gracedale administration to spend $5 million of the American Rescue Plan Act funds at Gracedale on retention bonuses. So introduced, and it was given a lengthy discussion yesterday, so there you go.
Absolutely. Council's discussion on this matter. Yes, Mr. Cusick.
Real quick, and I said some of these things yesterday, I think it's absolutely critical that we fill these positions. And my first instinct was this really needs to go directly towards the PPD, and I still believe that, but I'm not gonna let the perfect be the enemy of the good, and this is a good start, so I intend to support it. Thank you.
Thank you, Mr. Myers.
I want to reiterate the fact that, this is going to go a long way for us of trying to steal away people from some of the other nursing homes because it's quite an incentive. But in the same breath, I want to make sure we understand that this is hopefully the answer, but it may not be. We also have to understand that by us taking care of Gracedown and throwing this money, that we cannot forget the rest of the people that work for Northampton County. At some point, we do have to address that issue and give them some funds.
Any other discussion? Mr. Brown?
Yeah, I understand the need for the retention bonuses, and as I shared yesterday, based on the 5 million, this is the equivalent of extending retention bonuses to 500 employees. And we don't need to hire 500 employees, as I know in the moment. Administration shared that basically more they're concerned about the triage aspect, where we need that 30 to 50 employees to really get the right balance of employees to patients to get to the initial PPD. So my concern is not the retention bonus, but allocating all 5 million upfront now for that purpose. So I'd like to make a motion that the resolution, if you follow what the administration said, they need 50. So I'd like to see proof in the pudding, offer enough money to offer retention bonuses for those 50 that they're trying to hang on to. And if that works, let them come back and demonstrate with specific facts, saying, hey, we were able to hang on to these 50 employees after we recruited them, and then go from there.
This is the retention bonus and not the recruitment one, sir. The recruitment one will be next.
Right. This is to keep the people we have. Is this not correct? This is the one for the people we're trying to keep the people.
Yes. Am I misunderstanding you?
No, that's fine.
Okay, Ms. Zirinsky.
I just want to direct my comment to Mr. McClure and
Wait.
He's withdrawing.
You're withdrawing. Thank you.
Thank you for.
So yesterday, we did ask for, or I did ask for the breakdown of which employees would be getting this, the numbers of employees. And I think that that is what Mr. Brown was alluding to. Do we have those numbers?
Because you asked for them.
So we have approximately 450 employees at Gracedown at this moment, and that includes all nursing and ancillary departments.
So each of those 450 employees currently would be eligible for the $10,000, which is $2,500
Over 4
over a
years.
4-year period, each on an annual basis.
Correct.
And did you determine that that would be on the anniversary, or you have not yet determined that?
That one we have not determined yet.
Okay, so $2,500 a year for staying for the 4 years, and if for some reason they left at 3, there's no clawback.
Correct.
Right, okay, so the $5 million is enough.
Yes.
That's what we determined yesterday. And I'm going to vote for this because I think it's important right now to stop the hemorrhaging of nursing staff, of all the staff there. It is a moral imperative that we have to our vulnerable residents who need this care, who rely on this care, whose families depend on it, who can't take them in to their own homes and care for them. I am definitely going to vote for this, and I think it's important. Thank you.
I have a question for you. Of those 450 employees, how many of those are upper-level management?
And how high a level? Because you're talking supervisors, 30 to 40.
Will they also be getting this?
I think that was answered last night, I think.
I don't
think he said
remember the
yes.
answer, I'm sorry.
I think he said yes.
Will you be getting this?
I believe so. I don't need to take it.
Mr. Heckman?
And yes, and we did talk about this. So to Mr. Brown's point, I think when it was discussed, the retention and recruitment resolutions almost sort of were bleeding into each other because of very similar plans. So I understand how that works. And I mean, I wanted to see more detail. You gave it. And we are talking financial. So I support the financial part, but I do think we have to, and Mr. McClure knows, I said this, he talks about the non-financial. I think there's, and I spoke with you, Jen, there has to be a review of our management style, of management, of how we operate with the people. And I don't want to get in, I know there's union, at Gracedown, there's always been the unions involved. So when we talk about wages, we've always got to sort of defer a bit because that's a discussion administration has. But I think it's a starting plan, and I said in the back, and Mr. Kusick said it too. Who knows, there may be a better financial plan out there, but I haven't seen it yet, and this is what I have in front of me, and I don't want the perfect, once again, to be the enemy of the good. So I'm going to support it, but I do think that, and I did say, once we have them 5 years, you heard me say, they get a benefit, they're vested, they have a pension, so call it a paycheck for life. But I still think that's a retention thing if we use it right, because not many people can guarantee that, many employers certainly. So I'm for this, but I do think that we have to, besides money, there's intangibles that must be looked at closely, and I'll just leave it at that. But I do support the financial piece to keep the staff, because I agree with Ms. Zirinsky pretty much said what most of us believe, and I see it as a necessary resource. So that's all I have.
Mr. Gafredo.
To touch on what Ms. Hefner was saying, and it's tough to be the bad guy here, sitting here and asking the questions of, or pointing blame, but clearly Gracedown was in a very bad predicament. Could have been the pandemic, could have been a number of things, but I think it's wrong to be giving bonuses to administration when that's the responsibility, to run that place smoothly. Nobody here is running Gracedown day to day. You guys are, and if it wasn't for a number of nurses and Gracedown staff reaching out saying, you know, management is making it difficult, whatever the reason was, and I don't want to point fingers, but I think we're sending the wrong message by sending this bonus to the administration. I think, and I don't know if I need to make a motion, but I would like to see the same amount of money be equally divvied up between staff that's working, you know, nurses, CNNs, kitchen staff, whatever, but I don't think administration should be getting this bonus.
Any other discussion? Is that a motion that you're making?
If I would like to make a
So
motion.
how do you,
Hold on, we have to amend the resolution. Motion has been made to amend A motion has been made to amend the resolution, and then we vote on the motion, and then we vote on the amended resolution.
So I'd like to make a motion to exclude administration and to equally divvy up the $5 million among the shift staff or the labor staff.
is there a second? I'll second it for the purpose of discussion.
Okay. I could have just, John, what is your definition then of administration? Because we were talking about supervisory and that stuff. Who would you, I don't want to say.
Who do you want to look?
Yeah, you need to clarify.
Definitely managerial and non-bedside workers. So I don't know, you could probably more clearly define that for us, but.
See, that would be hard because you have supervisors that work on the units, you have RNECs that work on a unit, infectious control works on a unit, staff development works on units. So to draw a line in the sand on those people, that would be hard.
Well, I'm sure it's doable, and I'm like I said, I know this is not going to be a popular remark, but at the end of the day, when a Gracedown is failing, the only people that we can point to say, hey, what is the situation? It is the people running the place. And I feel like we're rewarding, and I understand you guys worked through a very difficult time, and a lot of people did. And not making, I'm not passing any judgment. But I will say I've heard the voices from a lot of people that work there, and time and time again, they say there's issues with management, They're not being asked, they're not being talked about, and they're not being addressed. And not only are we not talking about them, but we're gonna give a bonus. So I think it's contradictory, and I don't think it's sending the right message.
Yes.
So can you clarify approximately how many of your staff are actually in management and how many of those managers overlap with nurses like RNs or in housekeeping or whatever capacity? Because there are a number of individuals allocated here, CNAs, licensed LPNs, RNs, support staff. There's many people in management. And you would be an administrator, and would the director of nursing be an administrator, but also somebody who is bedside. So I think, I'm just trying to wrap my head around what Mr. Gofredo is trying to get at, and what the numbers would be if we were to entertain his thought.
I'm assuming probably 3 people would not.
And who would those 3 people be?
Myself, Dawn, and the ADON, Marion.
But the director of nursing also performs bedside.
Correct.
Okay. And you had already expressed that you would forego the bonus. Okay. And I wouldn't expect you to speak for Dawn or the DON. But I do respect that you would forego that and understand that you're the captain of the ship and you would like your workers to get the bonus first.
Absolutely.
Thank you.
Mr. Lott? And then, I'm sorry, did I miss?
Yes, this resolution, does go into some detail about who gets it, certified nursing assistants, licensed practitioner nurses, or, registered nurses, and support staff. I don't really see directors or you, unless you guys are considered support staff. So, I think we're getting really into the definition on this. And the other thing I would like to hear from, and I have talked to Gracedown employees, and we do have some, I would love to see some of our top management people go to, and they sent me to classes when I manage with people. There's so much to learn, I mean, the younger generation is quite different than I was, and I didn't realize a lot of the issues that they felt were very important, teamwork at work, flexible job, feeling value at work. When I got into the workforce, none of that meant much to me. It was all about money. But according to these courses they sent us to, it is a lot more. It's about working at a great place. And that's what we're trying to do. We're trying to make Gracedale a good place to work. So I would love to say, let's spend some money and, send our directors to, more of these management training, except for the problem with that is I don't want to send firemen to training school while we have a small fire burning, So I do think we do, listening to some of the employees, I think you need to, make sure that your directors, that your people directly under you understand what this administration wants, what this, and I shouldn't speak for the administration, but I believe I'm correct, but at least I've never heard anybody up here in this dais, it's always been concern for the workers, all of us. So, I think you really need to stress to your people that our employees are extremely important to us. And if they have issues, we need to honestly, listen to our employees. That being said, if you make such a good workplace, what I've seen in my career is places that create a good work, because you're always going to have bad employees. And one bad apple can sour a whole pie, so to speak. So, and I get that. And so there's different ways to go after that one bad apple. I truly believe you make a good environment where he's either going to come along, because the majority, I've seen it on jobs, whenever majority of the people have a great attitude, that person with a bad attitude either gets on board or gets out. And so that's what we really need to develop at Gracedale. And so I'm very interested in finding out, how we working with you to do that. So that's the management. I would also like to, I'm not, I would like to hear from the county exec again about, what he thinks, if it's appropriate to be paying our directors.
So if I could address your first point, it's amazing how great minds think alike.
Don't do that to
Ms. Cabali and I have been working on getting high-level managers training. And one of the high-level managers that we're finding a program for is our Director of Nursing at Gracedown, a management-specific program with an emphasis on communication. So we'll start there, and then we'll work our way down, because as you say, we can't pull people out of that building. There's not enough people in that building right now. But we thought, because the Director of Nursing touches everybody in nursing, we thought that would be an excellent place to start. And she's all in it, and she's looking forward to it, and I think you'll see benefits from that. Now, as to Mr. Gofredo's motion, if you take Ms. Stewart-King, who I would give the bonus to, because Ms. Stewart-King during the pandemic was also working as an aide on the weekends when we didn't have enough aides. I'd also give it to the Director of Nursing because she was actually taking care of residents during the pandemic when no one else would come in. But let's say we set those aside and they don't get the $10,000. The rest of the management or career service people must get it. It's not negotiable. It isn't negotiable, and here's why. Because they were all on the floors during COVID. They're all still on the floors during COVID. The ones that count toward PPD are pulled and sent out there. They're delivering meds, am I correct? They're delivering medication to the residents. I would think that they would be rightly aggrieved, seriously and rightly aggrieved, if they were not to receive this retention bonus, because the mere fact that they're in the career service and have some kind of supervisory capacity doesn't mean they haven't sweat and bled and cried along with everybody else. So I would not deprive them of their bonus.
Thank you. Yeah, and I figured Jen would not, didn't want her to answer her own question, and that, I wanted input from above, so thank you.
Yeah, you're welcome.
Miss, wait, Miss Simbo and I are working on something here.
Go ahead.
This here is pretty.
Thank you for your patience, Mr. Myers, then Mr. Brown.
Okay. I understand Mr. Alfredo's reservations. As a man who's been out there on the front line for the last couple of years while this is going on, I haven't been at Gracedown as much as I've been in the regular nursing homes. To eliminate anybody in the supervisory capacity would be like cutting your throat because they're in the mud with everybody else. That's my feeling on that. I see, I'm the guy that walks in at 5 o'clock in the morning and I see these folks busting their cookies with everybody else doing the same thing. I understand we all have heard the complaints from many employee at Gracedown, and I understand their frustration and understand our frustration, but I believe in the grunts getting taken care of. If you understand what I mean by grunt. If you're a military guy, you know what I mean. The people doing the work, we cannot eliminate. If the upper level wishes not to take the bonus, that's on them. But they were out there in the war. I don't know what they were doing. I wasn't there, but I can tell you the other places, they were out there changing beds and doing everything else there, and I can understand where you're coming from with your personal feelings on that. But as far as I am concerned, if we're going to do anything, let's make sure we take care of those immediate supervisors because those are the folks who actually busted their ass.
Mr. Brown?
One question, the difficulty I have with this is simply, how are you going to measure success? So it's a retention, I got that, right? But what's your starting baseline saying, hey, we know for every 10 we hire, we lose 5. What are the metrics you're going to have in place so that after year 1, if it's supposed to be a retention bonus, which is to hold on, but you're finding you're still bleeding employees and the program is not working. That's the difficulty I'm having with the structure of what you're proposing here. offering a bonus, a retention bonus. If you stay for the year, you get $2,500. I think previously I looked at that, it amounts to $1.20 an hour is what you're actually given over the course of the 2,080 hours that you work in a year to 40 hours. So I'm just struggling with these programs that you're bringing forth and a couple of the other ones. What are the measurements that you can look at and go, hey, we know it's been successful, we should actually do more, or it's not working, we actually need to bail?
That's a great point.
You know,
That's a fair, that's a
what
great.
I would like to hear.
That is a fair point, and I would be concerned about that if we didn't have a Human Services Committee meeting on a monthly basis where we spend most of the time in that meeting on Gracedale, and we talk about every aspect of Gracedale. And I think what we can do is we can make that part of our report. We can say, you know, before we started this program, we had this many folks leaving. Now the program is in place, and these are the folks that we've retained, and we can actually measure it with data points over time. And if at the end of a year or two, you say, well, you know, I'm looking at your data points, McClure, and it's no better, you know, your leakage is no better than it was when your retention is no better than it was when we started this program, then maybe we have to reevaluate it.
But shouldn't you, I guess, I'm going to ask a should, but that data should be available currently because you've gone from 800 employees down, or 800 potential full-time down, you're down to 450. This is not a new circumstance. So my concern is that information has not been provided where you can say, hey, look, we know for RNs, we're losing at a rate of 30%, CNAs, we're losing at 50%. Some gauge, so I understand the starting point of where we are today, so that I can evaluate this, as you say, on a month-to-month, or even a month-to-month may not be fair, a quarterly or a semi-annual basis.
That is a great point, but in a 400-person home, which is what we're at now, a 450-person staff, just about all of the, if I can use a graphic metaphor, just about all the blood is out of the body. I mean, we are at baseline here. This will be our demarcation point. We're at 450 people. We can't go any lower than that. So I think we'll be able to see in a year whether we were able to retain around that number.
Just to follow your thought there, Mr. McClure, so where I have a little difficulty then is with the information that's been shared. I think the director had shared, you have a request for agency nursing.
Yes.
Dollars, you know,
Yep.
that factors into here.
It does.
So I don't know, I don't have a picture and a scope to go, okay, fine, we have 450 employees, which are the ones coming and going? I understand where you're saying you're pretty much at that flat line point, you really can't breach that.
I think you've made that point over the last several meetings.
But I'm not clear that it's a 2,500. Where did the number come from? It was the evidence out there that says, hey, if we do 2,500 and, you know, 1,000 would be enough, or it should be 4,000. The evidence, to use your term, evidence-based practice to point to why this type of structure is likely to have a success.
And I can't stand here and say today that it will. But what I can stand here and say today, that is if we do nothing, if we question the process to death, we will never meet the metrics we need to meet. 2.7 PPD, 3.4 PPD, 4.1 PPD, and we need to start as soon as possible. And like I said, doing your oversight on a monthly basis in the Human Services meeting, you will be able to determine whether these programs are working. You'll have plenty of data points. But I know that, you know, like I said, the blood is almost all the way out of the body. We've got to stop the bleeding, and that's what this is about.
Mr. Myers, and I would like to comment.
Okay. Mr. Brown, I hear you throwing numbers out there. I'm in there every day. I'm seeing nursing homes at an unbelievable shortage of people trying to serve those that are in need of help. I don't give a damn about the numbers. I would need to get people in there to take care of those who can't take care of themselves. We're in the nursing home business, no doubt about it. But when we start talking about numbers instead of human beings, we're taking the equation away from what it's all about. And that's, I'm saying this because I'm seeing it. 2,500 is nothing if, in your mind, 2,500 is huge to the people out there working because of the other 6 to 8 nursing homes, nobody's throwing that kind of money out to the people. Mr. Cusack, when we first talked about this and we threw 1,000, he goes, that ain't enough. Damn right, John, you're right, it ain't enough. 2,500 is a huge start. And that's why I want to make this point crystal clear. It's about getting bodies in there and getting agency people the hell out. That's what it's all about. The agencies are draining the hell out of the industry. They're getting ridiculous amounts of money, and the nurses aren't getting that kind of money. If they're getting $500 for a nurse, the nurse may be getting $200. The rest is going in somebody's pocket. We got to get them people the hell out of our buildings and get people in there that are going to do the job. I had relatives in Gracedown. I had friends in Gracedown. The staff that took care of those folks, God bless them. I'm in the nursing homes now. Never thought I would be doing this, but I am. I retired 2 years ago. I do this to keep my sanity. It is a huge thing for me because now I get to talk to these people. And the biggest problem they have is they're not meeting the needs. And I'm not talking about ours. I'm talking about nationwide. There is a huge shortage in this industry. If we can fill our end of it and get people in, that should be our #1 priority. If that's not a priority, what the hell are we doing here?
I don't have a question, I just have a comment. Again, my concerns about this is that this is ARP funding, and it's not, I don't understand the urgency. Although after your comments yesterday, I appreciated your comment about why we need to do this now and why it takes time to turn around the boat. So I can hear that and I can appreciate that. My other thought is I really do care about the employees. I have complete agreement with what's been said about that. So I have no problem supporting money to retain employees. My concern is just the method with which most of this has been presented. Here's what we want to do. And then kind of no detail, and then all of a sudden we start to ask questions, well, what about this, what about that? So I just wish that we could have slowed this process down a little bit to kind of have more articulation, because I don't think we'd have to spend all this time debating it. I think it would have been 9-0, or 8-1, or 7-2, and it would have been done. But, you know, that being said, you know, I appreciate your patience and your tolerance with this. It's not against you personally, it was just a question. Are the upper level management getting paid, you know? Because again, it wasn't articulated. We didn't have any of these answers till yesterday. So I just appreciate your patience, Ms. Stewart-King, with that. If there are no other questions or comments from council members, I would like to call for the vote on the motion for the the motion to amend, not the amendment.
Okay. John, I just want to make clarification now, since with all the other discussion, are you, in your motion, are you just saying the Gen and the DON and the ADON, or are you still saying management?
That would be Jennifer or Ms. Stewart-King's area of expertise, but talking side here with Mr. Brown, who's saying that the union would probably come into play with excluding certain people that are in the union. Are you, I'm assuming since your administration, you are not a union worker, correct?
Service.
So how many other workers at Gracedown administration are non-union workers?
And that's the number I gave you, about
3,
30
right?
to.
So yes, those 3 members then.
Okay.
And
30, did you say, John?
3.
No.
3.
The DON, Dawn, and Jennifer Stewart-King.
So technically now, this is the motion, is to amend the resolution to, at the last paragraph where it says, now therefore be resolved, that the Northampton County Council hereby authorizes the county executive to direct Gracedown administration to spend $5 million of the American Rescue Plan Act funds at Gracedown on retention bonuses for all employees except the administrator, the DON, and the ADON. Correct? Okay.
So a yes vote means you approve the motion, a no vote means you don't.
The amendment.
Yes, the amendment.
Motion to amend it, yes.
Okay. Mr. Gofredo.
Yes.
Ms. Fargo Hefner.
Yes.
Mr. Kuzic.
Yes.
Mr. Giovanni.
Yes.
Mr. Heckman.
No.
Mr. Lott.
No.
Mr. Myers.
No.
Ms. Zirinsky.
No.
Mr. Brown.
Yes.
The amendment passes by a vote of 5 to 4.
Next, we'll vote on the amended motion.
The resolution as amended.
Resolution as amended. Thank you.
Mr. Heckman.
Yes.
Mr. Lott.
No.
Mr. Myers.
Yes. Change.
Yes, sir.
Can you change his vote?
Wait, do you want
confused.
discussion before we do this?
No,
Can I just, I want to make sure what I'm voting on. So
you're
this,
voting on the
if I
amended,
vote against this, I'm voting the whole thing down. This, the amendment has been approved, so
Right.
now we'll vote, I apologize. Yes.
Mr. Myers.
Yes.
Ms. Fargo Hefner.
Yes.
Ms. Zirinsky.
I just want to comment before I make I think it would have been a lot better if we could have voluntarily foregone your bonus rather than forcing them to forego it. But I'm going to vote yes on this whole entire thing.
Mr. Brown.
No.
Mr. Kuzic.
Yes.
Mr. Giovanni.
Yes.
Mr. Gofredo.
Yes.
The resolution is adopted by a vote of 8 to 1.
At this point, we've been sitting here for 2+ hours. I would like to take a 5-minute recess, please, and then come back and finish the rest.
That's a great idea. I would like to say, though, that the prospective daycare operators are here tonight if anyone has any questions for them.
Sorry about that, but I think we just really need a 5-minute break.
No, I just wanted to let council know that the prospective daycare operators.
Do I have to state? All right.
Oh, gosh.
You made a great statement, and I wanted to waive it. I do yes, yeah.
Sometimes they, so instead of always putting it on.
But to put that in a resolution, I'm not to vote on that thing, you know what I mean? Like, you understood, like, oh, because I was like, what? Otherwise, I'll remember.
Yeah, I didn't, I just wanted to look at it.
Yeah.
Yeah, I don't want to vote the whole thing down.
by the end of the month, construction really should start in earnest out there.
Okay. What's the time? Couple months.
Yeah, it's maybe around the end of the year, I think.
And is Meadows Road still on the tip?
Yes.
Because we got that thing from.
I guess help from the meeting
LVPC about its comments or.
Yep, it's still on there.
24.
They're telling us.
everybody was here. Yeah. I know, that is very good. That is good. That's great. That's what happens.
I am freezing. I know, this is dinner. Oh my God, what is back there that we can eat? I'm like, oh, there's taffy.
Yeah.
Brief.
Oh, you know what?
All right.
Let's see what
No, that was good.
I needed nobody brought us crackers?
I have a kind bar.
I swear, can I have like a little piece of it? I don't need a
You can have the whole thing, I don't care.
Do you have an extra one?
No.
I'll take half.
Salted caramel and dark chocolate.
Thank you so much.
I know, it's hard when you hear.
Well, I just, no.
No, take those in case you don't know how long the meeting's gonna be.
If it goes as long as these take. I have to be in a courtroom tomorrow morning at 9 o'clock. I might as well just sleep here.
I have to be here at 9 o'clock too.
Here?
Which courtroom?
Yeah,
I'm sorry, to change that.
no, it's great, I know. The only comment that I was gonna make was that Jennifer Street.
I don't disagree with you.
Jennifer Street had the opportunity to volunteer, it would have been better for the morale.
The recordings.
The morale.
Oh, she did volunteer.
But
She did
But
volunteer.
vote on the whole thing, allow them to volunteer that they all can take it, and then the morale of the crew goes up.
But I mean, Jen
Right.
did.
No, but
You can't, you have
Hey, Mike.
didn't.
Mike.
They're not here.
No, own it.
We could,
Supervisors have to make that decision another time.
yes,
Then it would have been.
what would have been great.
Now, we have to, poor little John Boy looks
We would have had cable.
Oh, but I don't know.
No, I mean, if we voted on it as was, as is, as it
And they can get
stands, and
bonuses
then later
anytime.
they said, you know what, we are not going to.
Yeah, I'm not against that.
Thank you. Do you know what I mean, voluntary,
But then
because
again,
voluntary.
once that's done, they don't have to.
No, but it would have been great if they had the opportunity to do that, because it would have been better for the
A
morale.
lot of times, I'll be taking administration officers don't get it.
Curriculum instruction making 100.
Feels so much better.
Or
yet.
What do you mean?
Well, votes.
Provisional ballots,
How many, so, yeah, does Lehigh County still have them out too?
409,
And we have about,
195.
oh shit, so yeah, you were 77, is it?
Yours
The job is dangerous when I take it.
Tara, 77 votes? 78. okay. You are so close.
I know.
And Brown's gotta be going nuts.
Do you know what I went up against?
All right, are we back?
Need Mr. Lyon.
No, Kevin's not back yet.
I don't care. I will get them.
No, you guys, there was a
where's
quite
Aileen?
a race, quite a race. Are you gonna bring them up next or what?
No.
Oh, okay. All right. I have to read the next one.
Thank you. 5-minute recess is ended. Next, we have the consideration of American Rescue Plan funding for new recruit bonuses at Gracedown resolution. Mr. Cusick, will you introduce this?
Sure. Whereas there is a need in long-term care facilities to encourage and recruit certified nursing assistants, licensed practical nurses, registered nurses, and support staff in Gracedale. Now therefore be it resolved that the Northampton County Council hereby authorizes the county executive to direct Gracedale administration to spend $5 million of the American Rescue Plan Act funds at Gracedale on staff recruitment bonuses. This was discussed yesterday at the Finance Committee, and it was moved forward to tonight.
Thank you. Is there any further discussion regarding this matter?
If I may.
Yes, sir.
I think in many ways, the discussion we had about recruitment, our retention actually rolls over into recruitment. With some little differences, it's money we're gonna get out there. I think again, we brought this up at the committee meetings, that, and Ms. Stewart King knows, and she talked about it, and we talked about it, that we need to talk to our public relations groups that we use, because up to now, we've had some difficulty. Now we're trying something new. We're infusing a lot of cash into it if we pass this. And we're going to have to really try something, because I do agree with the executive on this, and that we've all touched on it. I mean, Gracedale, I want families to feel confident and comfortable. I want the staff to feel confident and comfortable. But right now, like other homes, as Mr. Myers brought out, I don't want to single out Gracedale because I always hate that, but that's what we deal with. This is probably in all my time the most difficult period we're going through out at the home. I mean, this is a make or break situation. And so, yeah, we talked about this, and like I said, to me, a lot of this dovetailed with the other one. So that's all I have to say. I support it.
Thank you. Any further discussion? Mr. Cusick?
Yeah, I'll just add, as Mr. Myers indicated, I have been critical of how paltry the bonus offerings that we've had in the past have been. And I think $2,500 for somebody, particularly support staff or a CNA, is significant. And I'm going to support this. Thank you.
Thank you. Any other discussion?
I'm good, thanks.
Call for the vote.
Mr. Kuzic?
Yes.
Mr. Lot?
Yes.
Mr. Myers?
Absolutely.
Ms. Firego Hefner?
Yes.
Ms. Zirinsky?
Yes.
Mr. Brown?
No.
Mr. Giovanni?
Yes.
Mr. Gofredo?
Yes.
And Mr. Heckman?
Yes.
Adopted by a vote of 8-1.
Thank you. Next, we have the consideration of American Rescue Plan funding for capital projects at Gracedale Resolution. Mr. Myers, will you introduce this?
Whereas a need in long-term care facilities encourage and recruit certified nurses and assistants, licensed practical nurses, registered nurses, support staff at Gracedale. Now therefore it be resolved that Northampton County hereby authorize county executive to direct Gracedale administration to spend $1 million of the American Rescue Plan Act funds on the Gracedale capital projects.
Thank you. Is there any discussion regarding this vote?
Let me, I'm sorry, did he put his hand up? I have a comment to make, if I may.
Go ahead.
I was very leery about this, but then we did get a breakdown of what the money's being, and in fairness to Ms. Hefner, President, I think it's fair what she said earlier. I mean, the initial give to us was just a big number, and I thought the meetings yesterday, it really clarified a lot. And I mean, I thought the million, I was just thinking loading dock, but then it was talked about with the nursing station. And if I'm not mistaken, Ms. King said this million will actually be spent on things that we need to do anyway, that are critical with care.
Electrical.
And electrical. So I mean, and I will reiterate what I've said. So in that sense, okay, but I do think if we're going to save Gracedale or whatever, and we've talked about the possibilities, I think at some point we are probably going to, if these recruitment and retention things start working, then we're going to have to consider a fair amount of money. And the executive gave one idea, but I don't want it to seem like, well, $1 million is all we're ever going to have to spend out at Gracedale. So once I found out what the million was for, that made me lean, because I was against it, right? Because I just thought it was a loading dock. So I thought it was a lot for a loading dock. So anyway, but I appreciate that we clarified that.
Thank you. Is there any other discussion? My only concern is that I heard one thing, I heard Mr. Brown tell me some other things that were discussed, and I don't hear that the focus is on the room conversion, although I do appreciate that the electrical upgrades would assist in that. But I really wish, I did ask yesterday for a breakdown in a paper, I did not get that. So again, I just hate, I don't understand, again, why this must be done this night and why we can't do it 2 weeks from now with a better breakdown of how much money is allocated for each project, but that's just my opinion. If there's no other discussion, we call for the vote.
Mr. Myers?
Yes.
Ms. Fargo Hefner?
Yes.
Ms. Zirinsky?
Yes.
Mr. Brown?
Yes.
Mr. Kuzic?
Yes.
Mr. Giovanni?
Yes.
Mr. Gofredo?
Yes.
Mr. Heckman?
Yes.
Mr. Lot?
Yes.
Adopted by a vote of 9-0.
Thank you. Next, we have the consideration of American Rescue Plan funding for agency nursing staff costs at Gracedown resolution. Mr. Brown.
Whereas there's a need in long-term care facilities to encourage and recruit certified nursing assistants, licensed practical nurses, registered nurses, and support staff in Gracedown. Now therefore be it resolved that the Northampton County Council hereby authorizes the county executive to direct Gracedown administration to spend $2.5 million of the American Rescue Plan Act funds at Gracedown on agency nursing staff costs.
Discussion regarding this matter?
I'd like to make a point.
Yes, sir.
I already mentioned the fact that the agency nurses are bleeding the hell out of the industry. And if we can get new people in and we can eliminate them, and there's money left of that, I would like to see that money go back into whatever capital projects we can use at Gracedown. I would just like to make that a motion to add to that. If there's money left over, that money be used to do that.
I'm not clear on the change that you're asking for.
Once we fulfill our requirements that we need, and the agency nurses are gone, because it's 2.5 million. We only had, if we don't spend all that money of the 2.5, I would like to see it go back into capital projects to build.
So you want to designate it?
I want to designate the rest of the money, go back to that. Can we do that? I bet there's a motion to amend,
Specifically for capital projects, though.
yes, specifically for If we recruit and get the people that we need, what's going to happen to the rest of 2.5 million?
Goes back into the fund, correct?
It stays at Gracedown into the fund balance.
So it stays at Gracedown.
Stays at Gracedown. Can we use it, can it be used for capital projects?
Yes, but transparency requires me to suggest there won't be anything left of the 2.5 million. We have to get to 2.7, 3.4, and 4.1, and we will not be able to do that without the agency piece. I think we had a discussion about that last night, and that money will probably be exhausted by about February of '23.
February of '23 at the current pace.
So while I appreciate the reservation of the money, I doubt there will be any.
Okay.
I wish I had a better answer for you, but I don't.
Mr. Lot.
I'll pull it then.
Yeah, this is definitely a tough one. You know, like Mr. Kuzic said yesterday, I totally agree with him. It almost like we're feeding the bear that we're trying to get rid of, you know? And so it's an ugly, ugly vote for me anyway, because I really don't like what the agency nurses are doing to our different homes and our hospitals. And it seems like everybody realizes it's an issue now. But unfortunately, when you get in a situation, sometimes you have to do what you just don't really want to do anyway. But just for the big picture, I'm going to support this, but against my better judgment, quite frankly. Thank you.
Mr. Brown.
Just a couple clarification points. In the 2022 budget, there was, I assume we budgeted for agency nursing. How much was budgeted that was approved by council? How much of that has been spent to date?
you have the spent to date that I don't know? It was in that first quarter financial sheet we gave you, so hold on a second. Do you know what page Gracedown's on, Jen? You did. That's why I couldn't find it. So it is not broken down on here. I do not know how much is spent, but I believe we spent about 2.5 in agency. We are probably about 60 to 65% of the way through that budget this year. That's why the 2.5 is in there. Gracedown does have a fund balance. If we move the money within the agency, we wouldn't be bringing you a budget amendment for that. I anticipate the $2.5 million to be gone by February of 2023. We wouldn't, to be clear, we wouldn't be amending our budget. We would just be moving it from Gracedown's fund balance to cover that cost. We also may have some money in fringe benefits with the open positions that would, we also have some money in our open positions that would infringe benefits that might be able to be rolled down into that. But again, it would come from the fund balance.
Let me just, I just want to track with you, Mr. Barron. So you budgeted for 2022, 2.5 million in agency fees. You, and the administration is requesting another 2.5 million to bridge between now and February, potentially of 2023, based on consumption.
We're gonna have a better budget. This is clearly a use for the ARP money. And while Gracedown has a lot of other needs that the fund balance will probably go towards, this was a good use of the ARP money.
Yeah, I'm not concerned of the source of the funding. I'm concerned at the burn rate that you've gone through. You budgeted 2.5 million. I just want to be clear, you've consumed that in agency. So now you're asking for another 2.5 million to support agency for the remainder of this time frame that you're talking about.
We haven't consumed it yet, but we will very soon.
So the answer is yes, you'll consume what you budgeted, and you need another 2.5 million to.
Through
Is that
2023,
an accurate statement?
we probably need another 1.75 million.
But you're asking for 2.5. But
Correct.
Right, okay, so.
It depends on how fast the recruitment, retention, all those other things go. I'm just saying at the current pace.
That's fine. So the follow-up question then is, what was unanticipated when it was budgeted 2.5 million that has you here now? What changed?
So the ability.
You're doubling your ask.
The ability to hire has, well, let me answer your question. The ability to hire has become more and more difficult throughout the pandemic. Go ahead.
There is one major, Mrs. Stewart King just prompted me, there's one major factor, the shot mandate. The shot mandate, the vaccination mandate.
Yep.
That was a precipitating factor that has led us to have to replace all of those people. How many people is that, Jen?
40.
Yeah, at least 40 or 50 people, depending on, who's counting. So that was the big precipitating factor that led us to understanding that we need to ramp this up now.
Okay, thank you.
So, sorry, Ms. Zirinsky, then Mr. Heckman.
Thank you. So are the agency nurses required to get that shot as well?
Yes.
Okay. And my other question, my initial question was, is the cost per agency nurse going up?
Yes. The contracts are higher than they used to be.
Right,
Yes.
so when you budgeted in 2022, presumably the cost for an agency nurse was one price, and now it's much higher, and it is ever increasing. Is that why you're asking for the 2.5, so that you have a cushion?
In part, yes.
Okay. That's what That's what I
She's
anticipate.
asking the question. You're your long ones, she got right to the point. Thank you.
Yeah, I just figured it was
Thank you, Commissioner
anticipatory
Zansky.
because I understand that agency nurses are in high demand. The requirements of their compensation is ever increasing, and we don't know where the ceiling of that is yet.
So when AMI was brought in companionship with the National Guard the last time, and they did their review, their house-wide review of Gracedown, they said the only problem we had was staffing. All the other protocols were in place. We were doing fine with everything else. Staffing was the issue. And Dr. Miller, who from DOH, he's a special consultant at DOH, was in contact with Stuart King, and his one suggestion was we find a way to get more agency in.
Right.
And that's what we're doing.
And so this is,
We're following Dr.
Yeah.
Miller's suggestion.
but this is just another necessary expense to stop the hemorrhaging of nurses and make sure that, yes, Gracedown stays open, but also that our vulnerable residents there get the care that they need. And again, that's a moral imperative that we have as a county.
Yes.
Because that is our Gracedown. Those are our neighbors and friends. Family, yeah. Okay.
Mr. Heckman?
No offense, but I don't want to talk to Mr. Barron or Mr. McClure. I'd like to talk to Jennifer Stewart King.
That's a
Sorry,
lot
guys.
of offense.
Not offended.
Good. Mr. Barron might be, because I know he gets. Anyway, I know, and you know, historically, we've always used agency nurses, even sometimes in the best of times to fill little holes here and there.
Correct.
Now it's crazy, and I would assume it's probably crazy at other homes too, and that's another reason to push this up. So they're like the company that makes that baby formula. They're in the driver's seat because, like, you know, you have a monopoly, and that's what happens with monopolies. You make a certain thing, and then they've got you. So, and I realize this, that now you've seen this over the years. What rate of increase have we seen over the time you can remember, before maybe even your son, that we have had to use agency nurses? And Mr. McClure mentioned in reference to COVID shot, which we all know, you know, what came of that. But I mean, including that, without specifying it, what has been, what you would say from your perspective, has been the rate of increase of having to use these nurses?
When I first started in 2005, we had agency staff, and it usually was just the RN or an LPN. About 6 years after that, maybe 2011, we started to use agency CNAs. So we started that process coming in. I have about 7 contracts with agencies right now. And I can tell you the top 3 did not go off the rails when we negotiated a contract with them. So there was a difference, but I was happy with what we got.
I mean, the actual bodies, we have to use, the use of agency nurses, the number that's in the facility over your tenure has gone up because of people leaving?
It slowed down because of COVID. The agencies left. They left the industry. And then that was the beginning. And then as they started to have the real employees start to leave, agencies realized this was the moneymaker, so now they've increased it. I've tried to stay away from agency usage. We really, until the mandation occurred back in August of last year, we were actually at 3.2, 3.1. We were in the 3s. And then the mandation came, and people just didn't want to take it. And we kept losing people from that.
And we know, you know, we all went through it, and we know what you dealt with out there. But, you know, we talk about agency nurses, but it's actually nurses, LPNs, RNs.
Correct.
It's the CNAs. And let me just say, having spent a lot of time at Gracedown over the years, and I was counsel and director, I'd go out a lot, and I'd always praise the CNAs because I said I wouldn't be able to do the job. I mean, that is a tough, tough job, and they just don't get paid well enough. And that's I'm not picking on us. I'm picking on us and everybody else.
Right.
We were talking earlier, Mr. Lott is he's a new baby boomer. I mean, he's one of the youngest baby boomers.
The last.
He's the last.
Right.
I'm sort of towards the beginning, but I don't want to go, I mean, I'm more of sort of towards the beginning of boomers. But I've often said, there's, I don't know how, 60 million, 30 million, I forget the millions. But there's a lot besides people that are there, and a lot of boomers are going to end up in places like Gracedown. And if we don't do something, well, I've said this before, from the Fed on down, we're just totally losing sight of, and we usually don't react until there's a crisis. But the need for people like CNAs is just critical. So
My hope.
I agree that in the sense of, I don't like the agency nurses, but I sort of liken it to putting your finger in a hole in the dike. Unfortunately, now we have to put our thumb in, and hopefully pretty soon we could just put our pinky in. So
And my
since we're
hope
all
is-
using colorful metaphors tonight.
My hope is to convert them. That is my goal, is to convert agency staff to our own staff. They come in, try it, like it. That's the goal.
Still,
So I'd like to make
American dream.
a motion that I think would be in a spirit of compromise. Because I agree with some of my colleagues, but I also agree with your need to do this. I'd like to amend this motion from $2.5 million to $1 million. And then you're always welcome to come back and ask us for more money, because we have this money till 2024. If you need it again in September, if you need it in December, you can come back, because we can expend this at any time. It's not going anywhere. So I'd like to make a motion to cut it down to $1 million instead of $2.5 million, and then they could always come back and ask us for more. I need a second on the motion before there can be questions or
second.
discussion.
Second.
I have a second. Thank you. Discussion.
If I'm not mistaken, Mr. Barron said 1.7 would get them through.
To February 2023.
To December.
All right. So today is May. And
1.7.
we're giving them money for recruitment. We're giving them money for their staff retention. If she converts some of the ones she gets, she may not need all of it. But if they go, oh my God, we need it, then they can come back in September. They can come back in October. Again, I don't see why we have to rush this money out the door. We have it. First of all, we don't even have it yet. So give them $1 million and let them say, okay, here's where we're at. Maybe they don't need to burn it, because maybe this recruitment will work, which is why we're giving them this money in the first place. And then that way, it speaks to the spirit of what Mr. Lott and Mr. Cusick said the other day, which is, let's not be paying these folks more than we're paying our employees. So that's my rationale. Can always come back and ask for more. He even said he could come back and do a budget amendment if he so needs, to move money from the fund. Mr. Gafredo.
Just to reiterate what Mrs. Hefner's saying, it will be a good check on Gracedown, because it will give us an idea of how the success rate's going of the we're trying to obtain new nurses. And if that works, we should hopefully be using less staff nurses or temp nurses. But if we give them the 2.5 million, the money will just go in any direction there without any oversight from council. So this is our way of being able to see how the money's being spent. If they need more, that's telling us that acquiring new nurses isn't working. I like the idea of it. I'll be voting in favor of the motion.
Any other discussion?
Let me, Mr. Barron, your time to shine again.
Now you want to talk.
A little bit. The executive talked about our Human Services Committee meeting, and as we go forward, getting numbers. So to Ms. Hefner's amendment that she's offering, if we do $1 million, you're going to come in each month and you can tell us how much money you've had to spend on agency nurses, and then we can extrapolate maybe what we would need or not need money-wise. I mean, it's just, you can tell us that.
If I had to guess, I'll see you in September, as the song goes.
Tonight's just getting crazy. All right, so, all right, okay.
So the vote is for the amendment.
Ms. Fargo Hefner,
Yes.
Mr. Gofredo,
Yes.
Mr. Giovanni,
Yes.
Mr. Heckman,
Yes.
Mr. Lott,
No.
Mr. Myers,
No.
Ms. Zirinsky,
No.
Mr. Brown,
Yes.
Mr. Kuzic.
Yes.
Adopted by a vote of 6-3.
Now we can vote on the resolution as amended. Is there any further discussion? Call for the vote.
Mr. Brown,
No.
Ms. Fargo Hefner,
Yes.
Ms. Zirinsky,
Yes.
Mr. Kuzic,
Yes.
Mr. Giovanni,
Yes.
Mr. Gofredo,
Yes.
Mr. Heckman,
Yes.
Mr. Lott,
Yes.
Mr. Myers.
Yes.
Adopted by a vote of 8-1.
Thank you. Next, we have the consideration of American Rescue Plan funding for daycare renovation and operation at Gracedown. Mr. Giovanni, will you introduce this resolution?
Yes, I will.
So excited about this.
How am I stuck together?
Who's reading this?
Okay. Whereas there is a need in long-term care facilities to encourage and recruit, nope, that's the wrong one, I'm sorry. Yeah.
Read the now therefore be it resolved, because all that's the same on all of
Okay.
them.
Now there be it resolved that Northampton County Council hereby authorize the county executive to direct Gracedown's administration to spend $2 million on the American Rescue Plan Act funds at Gracedown on a daycare renovation and operation cost.
Discussion on this motion. I believe the organization is here if we have questions for them. Mr. Brown, then Ms. Zirinsky.
Yeah, just a point of clarification. I thought yesterday that this had been amended to 1 million.
No, I think that was a mistake. It had been written as 1 million, but that was a mistake, and it was actually submitted as 2 million, and when we checked the data,
Okay,
it was
thank you.
originally
I just
2
wanna-
million.
That's correct. Thank you.
Ms. Zirinsky?
So I just want to say that I think that it is great leadership that we are going to put a daycare at Gracedown. I know that at Northampton Community College, my son was able to attend the Jeanette Reedman Child Care Center. And it made all the difference in the world in allowing me to be able to work. It made all the difference in the world to have my child on premise with me. So if anything happened, or if I just wanted to visit my son, I could do that whenever I needed to. When he needed me, I could always be there. And I think that this is an important and progressive step forward, not only as a model for other institutions in the county, but also to say that we care enough about our employees and their retention that we are going to make this available for them. And I just want to applaud the administration, and I look forward to hearing from the two ladies in the back, because I know you've been sitting there so long. So
Well,
thank you.
We're going to have discussion first, and then we'll call them up for questions. Mr. Lott?
Yes, I'm very excited to support this, and there's a couple reasons. One, I think it's really great. It hits our employees where they need it the most, when they're starting a young family. I know from my life experience and many people around me, we struggle the most when we start our families. We're paid the least, and so this would be a big, big help for young people to get them in the door. I mean, to have a daycare right at your facility is a huge recruitment, I believe. If you look at the studies, it's been mostly the women that have not returned to work. The percentage of people not returning to work are women. When asked why people are not returning to work, it's a lot of the answer from these women are the daycare issues. So I think we're hitting an issue that's truly an issue. So I believe it's going to be a very good recruitment tool. The other thing I really like about it is we have the capital space, we have the facility to put it in. I mean, we're not out there trying to, find somewhere to put, we have room out there. I know we're gonna bring that area up to code, but in my world, a job, from what I'm understanding and heard last night, in the commercial construction, we call it more like a paint and paper kind of job. I mean, it's a couple walls we do, it's a bathroom or two, it's some electrical work. This is not a huge project, so it's not a huge capital expense. I believe Mike said it was a couple $100,000. I think he might be a little low there. I don't know if he bought lumber lately, but I did, and it's brutal out there. It's not a huge capital expense to try this out. And I also heard some concern about, well, we get this project in place, and then after the money runs out, where do we come up with the money? Well, if this project works, I know how much advertising, marketing costs. It's extremely expensive. If we can cut some of our marketing down, there's going to be a little money there to roll over to try to maintain long-term the daycare. The other thing, the other thing about the money is, and I know, and I said this to John, but realistically, when this money runs out, if this program is not utilized and is not working well, that's a great opportunity to pull the plug on it. We're out of money, we're not gonna budget more. I understand, John, government things are very hard to kill. But there is I believe there is a good out after, if it doesn't work. I believe it's a great idea. I really believe it's how it's gonna be installed and administered is what's gonna make or break this thing. So, and that's not on us sitting up here. That's on administration. They're gonna have to deliver us a product that works down there. So I am excited to give this. I think it's a great recruitment tool. I think it's great for our employees. I think it hits employees that really need that money starting out. So I'm excited, and I hope to God this gets, administered correctly, because I really think this has a great opportunity to work for us. Thank you.
Mr. Myers? Sorry, I didn't see it.
That's okay. I have reservations. Because we're gearing all this to one spot, and I don't know if future plans, we plan on doing it for the rest of the county. And I also have, what happens when the money runs out? That's my biggest fear at this point right now. I'm not worried about the folks that are going to bring in to do the job, because I've been around that too long to know that they're well-staffed. They do the best they can to get the correct people in. That's the least of my concerns, ladies in the back. I had family involved in that, so that's not my concern. I'm more than happy with that. I'm just a little concerned what's going to happen when the money goes, and, because we're just gearing it for Gracedown. There's other entities.
And if I could just follow up to what Mr. Myers said, located right next door is the 911 center and the new forensics center. I guess my question is, if space were available, could we make it available for the employees of those two entities because of the proximity?
Yeah, so when Ms. Wondolowski, who spearheaded this for us, talks about this, she talks about this as a pilot program. So if it works, we might be able to, I don't want to promise we can extend it out to other folks within the county, but yes, if it works and there's space, we would be happy to do that. I don't know that we could do it from the first instance, though, because we are piloting it, and I think the best way to pilot it is to limit it to Gracedown. And as far as the budgetary impact going forward, so when the books close, rough estimate, it's going to be about $97 million in revenue for Gracedown. So I'm not great at math, so I went to law school. I could only multiply by 0.33. But the fact of the matter is, I think it would be moving forward. If we had to use county money, if you will, it would, the budgetary impact would be 0.005. The value of it going forward would be, is my math right?
Yeah.
Do I get did I get an A?
I think that at this point, though, that council ought to include something to that effect, though, in this resolution. So I think what I'd like to do is make a motion to add at the end, where it says on a daycare renovation and operation cost, for Gracedown, 911, and forensic center employees, if space is available in the future.
Could you say that just again, please?
Okay.
After the operation costs for Gracedown 911.
For Gracedown, 911, and forensic center employees, if space is available in the future.
Hold on. Can I just?
Motion and second, Linda, you got it? Go ahead.
I think that would need clarification, because it makes it seem like from the get-go, Gracedown 911 employees in the forensic center, if space is available. I think you would have to say that the priority goes to Gracedown through the pilot period, and if space is available, the 911 center and the forensic center would be made available to them. Do you see what I'm saying?
Yeah, I'm amenable to changing the wording but I would like to see those two entities included because of the proximity
Okay.
and the potential usefulness.
So if Tara could repeat
So
the
the-
wordsmith.
Well, wait, let me just, if we can put for Gracedown, then 911 and the forensic center employees, if space is available.
That's,
I think that's not
For
as
Gracedown
much.
as priority?
Yeah, Gracedown as priority during the pilot period.
no. No.
I think we could live with the original language of his motion. He had
Well, but-
the
excuse me, Mr.
clause in the
McCord.
future.
Let them do their process. We appreciate that, but
I just think that it has to be outlined that this is for Gracedown employees first. And then, if space is available.
Yeah, and I think Ms. Zembo's
Yeah.
suggestion to add that word "then" in would work.
Yes, okay.
and you don't want the word
Could-
as
Linda,
priority?
could you repeat that for us?
Okay. So then it's going to say to spend $2 million of the American Rescue Plan Act funds at Gracedown on a daycare renovation and operation cost for Gracedown, then 911 and forensic center employees, if space is available in the future.
That works for me.
Okay. So I'll state that same motion if you'll second that.
And I'll second it.
All right, is there any discussion on that motion from council, on the amendment? Thank you, from council.
On the amendment.
No discussion? Call for the vote on the amendment.
Mr. Kuzic?
Yes.
Mr. Myers?
Yes.
Mr. Gofredo?
Yes.
Mr. Heckman?
Sure.
Mr. Lott?
Yes.
Ms. Fargo Hefner?
Yes.
Ms. Zirinsky?
Yes.
Mr. Brown?
No.
Mr. Giovanni?
Yes.
Motion passes by a vote of 8-1.
Good, now we have the actual resolution to
Yes.
continue to discuss. Is there further
amended.
discussion? Mr. Heckman?
Once again, no offense, I'd like to speak, I have a question for the ladies in the back, if they could come forward and you would introduce them.
I will
My
gladly,
question goes directly to them.
will gladly introduce them. So we have Tanya and Jody from Learning Locomotion, and I'm now forever indebted to them for sitting here all evening, so thank you. And whatever questions you have. Yes, Ms. Zembo.
What was the name of the?
I will let them reintroduce themselves, and then you can ask your questions.
Locomotion.
Learning Locomotion.
Okay.
Good evening, Council. My name is Tanya Pifley. I am the owner of the Learning Locomotion. We were established in 1998. Our first location was in Bangor. Then we followed up with a second location in Stockertown. Our third location is in Wind Gap, and we have now formed a partnership with CIT, and our fourth center will be open June 6th.
Wow.
Go ahead.
Hi, my name is Jody Williams, and I am a director at the Bangor location.
Okay.
You have questions?
CIT is Career
Of technology, yes.
So you're actually set up in a school, I'm sorry.
Kevin, your mic's off.
Your mic's on.
I was just asking what the CIT, but
You
it's
have
the
the floor.
local tech school, thank you.
Mr. Heckman has the floor.
This has come up in discussions amongst people here and there and wherever it's come out. First of all, bless you for sitting through a local government session. I don't know if you've ever sat through a local government session. You may never want to again, but I appreciate your patience. But this is a big contract. An issue would be, have you ever done this where you've had senior citizens, like in a residential long-term setting, and children combined?
I'm going to say yes and no. We partner with the Bangor High Rise, which is located right behind our facility on 215 South First Street. So we have been in their facility. We have done trick-or-treating in their facility, Valentine's Day. We hold our graduation ceremony there. So we do have a partnership with them, but we are not in-house with them.
All right, a question then would be, as we lay this out, and we've gotten the construction and where it would be and everything, as time has gone on even more so, our residents, we get a mix of residents. And we do get residents that have health issues that make them maybe less controllable, or that have maybe a background where they wouldn't necessarily get I forget what's the number of the form, you have to go through the FBI thing. We all have to.
Clearance, they're not going to get a clearance.
Well, but
Child abuse.
I guess the question I'd have is, from a safety standpoint and from a legal standpoint, I guess you could say, is you're going to have to, how much supervision is going to be necessary, or who's going to have to ensure, are you prepared to be able to ensure the safety of the children in regards to this, to the residents they may face? And Jen Stewart King would know this, what I'm talking about as well. I mean, it's not like all the people who could be potentially, I don't want to say dangerous, potentially problematic are in a place where they don't come out. They could end up mixing, and I watched the tape they showed us. So I guess my question is, and I'm sorry, I didn't get my caffeine drink this morning that I had yesterday. Are the residents going to be mixing with the children at any time in your program?
I'll take it, you
can follow up. Okay.
So the short answer is yes, but where we talked about where they will be located, right? So the daycare is a separate wing, it's a locked wing. So the only folks who can get into that wing are daycare staff, period, unless we allow parents who are using the daycare to have access to that, but that would be it. So it'd be very minimal. So they will, one of Jen's goals in particular, because of where it's located, it's right next to the chapel. And so you could have plays, you could do these trick-or-treating activities, things like that. But just like at any other place that these ladies operate, the children would never be unsupervised by daycare staff. So Gracedown staff would be very intentional about which residents, were going to be participating in some of the activities. So some folks who might not be, maybe don't have an appreciation for young children, those folks we won't necessarily participate in activities with together. But to your point, because we were discussing this earlier, the safety concerns, they would never be unsupervised. No matter where they are, the daycare staff would be overseeing them at all times.
What's the staff ratio of staff to children?
Let you answer that.
Okay, this is a long-winded question. It depends on.
I mean, that was one of my shorter questions.
It all depends. For an infant, 4 infants, 1 staff. Younger toddlers, it's a 5-to-1 ratio. Toddlers is 6-to-1 ratio. Preschool is a 1-to-10 ratio. Pre-K is a 1-to-10 ratio, and school age is a 1-to-12 ratio. But that could change if you have 7 infants, you're going to need 2 teachers.
Do you have an age limit?
12.
I think that was mentioned, thank you. And a beginning, like?
6 weeks.
6 weeks? Whoa.
6 weeks.
We don't get a lot of those, but,
But sometimes it happens.
right.
Yeah.
And we've had parents that, one in particular was in the health field, had to go back to work, so I think we took 4 weeks. We've also had parents that are foster care parents, and they needed placement. So, depending on the situation or the circumstance, we will
No, I think
longer,
it's
but-
great, except for the staff. Boy, that's a 6-week-old baby is a lot to manage.
Actually, 12-year-olds are harder.
Well, I've been around young people my whole, I in another way, yeah, I know. You have a room where you just sort of shuffle the 12-year-olds and close the door. But anyway, thank you. You answered my question.
Any other questions, comments? Mr. Brown?
How much do you charge per child? Is that for your private?
Right, there is a certain amount for an infant,
Right.
then
So
preschool.
what's your average per child? Just an average over the spectrum? Is it $100 a week? Is it $800 a week? Is it?
I would love $800 a week, but
I'm
no,
trying to
on
get- I'm trying to
average.
get a gauge on the value of the service being provided.
Right, now you also have to understand our Bangor location, which is low income, is a lot cheaper than our CIT location, which is a better demographics. So on average, for an infant, we just raised our rates for an infant would be $220
Per week?
per week, which is on the low side. Wow. Compared to other places.
Could you just say that again? Because
$220 a week for an infant, but we are one of the cheapest centers in the area.
for how many hours?
That is for an 8-hour day.
Up to 10.
And then the other end would be for the 12-year-old?
Right, which for our
young
summer
adult.
camp program, we're charging $165 for the week.
Did you say 165 for the week?
I know, and that includes food.
Breakfast, lunch, and an afternoon snack.
3 meals, all.
John has the floor.
So, and the reason I go there is based on, and I'll make it real simple math, at $200 a week for 50 weeks of service, right, that's about a $10,000 of value. So, and I believe it was shared that for the initial pilot, this might be directed to you, so you're anticipating maybe up to 50 children? Is what the initial build-out would accommodate.
Yes,
Right.
30 to 50, depending upon the
Depending, right?
ages and the
Okay.
ratios, yes.
So I guess my question then, and this, I'll shift away from you, and this may be more towards the administration. So, and I'm going to assume a 1-to-1 ratio of parent to child, so you're able to recruit 50 parents. Then the way the county seems to work, everyone else is going to want to go, well, I want $10,000 of value also. Or if we roll it out to the remaining 1,800 full-time employees that you have, suddenly this thing balloons into something that's financially a challenge. So,
Sure, so as we talked about, it's a pilot program, and so we'll see how it goes. Some of our folks who are eligible for daycare subsidy, we will have them apply for that, and so that will help offset some of our costs. So,
right, no, and I understand that.
Okay.
And I understand the cost that the county will absorb and how to do that. But I think Jen had said we have 450 employees currently
Correct.
at Gracedown. And let's just assume 50 of them participate and can take
Sure.
advantage of this. The other 400 are going to go, well, I want $10,000 of value in some other way because they're getting it. Why don't I get it?
Right.
I'm showing up just because I don't have a kid.
we've talked about that, actually, and we've talked about that with.
How would you address that in
Yes.
light of everything else that, all the other monies that
Sure.
are going into the facility?
And we've addressed that with some staff already, because that was one of the first things brought up by folks who don't have children. And so there's a few things. One, we're providing, as a recruitment tool, hopefully more staff to allow our currents to have a little bit of a break.
Sure.
And to have more support and all of those things. Having more staff will allow them to be able to use their vacation time and their personal time as maybe a little more flexibly than when we have fewer staff folks. So there's no $10,000 check going to people who don't have children, you know.
No, I understand that. And human nature would say, great, I got my vacation in, things are starting to rebalance. Now I want my pound of flesh. I want my 10,000 in value. And it is, we're talking union, right? So as we said earlier, I think, Mr. McClure, we talked about the other, where it's all or almost all or nothing with the retention and the bonuses, because it's primarily career service. So I find that to be it's going to be a problem eventually by building this inside and handling it the way I think it's being proposed. And that's a concern, you know, that I have, because it's not now the 2 million and I think it was 400,000 a year you're proposing the operational cost to it. It's now 400 employees by 10,000. We just added 4 million to that equation just to satisfy the value proposition to the employees not taking advantage of this particular opportunity. You know, I think daycare, yes, I agree, daycare is a good marketing tool, a good recruitment tool ultimately, but in this kind of environment, I see that really becoming a problem. And then the reason I voted against the amendment that Mr. Cusick offered was because now we're going to expand it beyond the 450 employees, and that then just kind of compounds the problem overall. Either we got to add more facilities and find some other way to satisfy that. So that's part of my my concern. Once you get past the triage and things stabilize, that's where I see this going. In your evaluation of proposing this, had you considered just supplementing to using an outside daycare center where at least as you come in after year one, year two, you know, incrementally, we'll give you $500 towards a supplement, so on and so forth, to see if the recruitment works.
We actually
Or investing at this level.
We actually did discuss that, but I'm going to blame the hour for my totally forgetting. We did discuss that. I don't know if any of my colleagues recall why we didn't go that route. I'm drawing a blank at the moment, but that was discussed because. Sure, it was a path of least resistance initially, but ultimately after discussion, it seemed the overall benefits were better to do it within Gracedown, but go ahead.
Well, and we have spoke at length. There is also a daycare shortage. So having a daycare on site will enable the staff to work. Giving them a $500 voucher, there is no centers. In your area alone, Bath, 2 centers have just shut down. In Nazareth, another center has shut down. There's a 2-year waiting list at My Buddy's daycare in Nazareth. So giving them $500 is not going to do them any good because there's nowhere for them to go.
Yeah. I have some questions. So how do we select the employees who get the benefit? Is it only for the new recruits first?
No, it would certainly, although that's not a detail we've completely finalized, certainly it's current employees, and we've discussed first come, first serve, but that's not been finalized. We definitely want to find a way to make that as equitable as possible for folks. And part of that initially will be, gauging interest among current staff. For people who are already there, a lot of them will already have, if they're using daycare, might already have daycare set up that they don't wish to switch their child from. Now, if money is obviously a challenge, that might be different. So certainly it will be, I think, unless I'm speaking out of turn, to current employees first, and then with space permitting, which we anticipate there will be space permitting, to use it as a really good recruitment tool.
So how many employees that are currently there have expressed interest or need in doing this at this time?
I think Jen has an idea about that.
Sorry, I wasn't here last week. I don't know if you all asked these things, but I just want to know.
I don't have an actual number, but I can tell you there is a lot of interest from a lot of single mothers especially that are looking to bring their children in. I talked to one that just came up and moved into this area, came to work for Gracedown, but she's having a problem finding a daycare. So right now she's working PRN, would love to go full-time, but she can't do it yet.
So, and remind me the hours, you said them yesterday, but I forgot, because we were looking at extended hours, or are we looking at traditional daycare hours?
Well, we're definitely looking at 6:30 a.m. to 7 p.m. minimum as daycare staffing permits. And if there is a need, we at some point would love to see that go until closer to 11 p.m. I'm not sure, how long it will take us to get there, but at least I think Jen talked yesterday about going to 7 or 7:30 p.m. we have a lot of folks who work day shift and then they'll work maybe 4 extra hours. So that would buy them the daycare time for those 4 extra hours on the second shift for the daycare to remain open or for someone else to pick up the child.
What about drop-in and emergency care? Say somebody who has children in school, but all of a sudden there's a snow day and I need
Yes.
my kid to be here. Is there going to be room within that 30 or 50 for those children to be accommodated?
That's the goal. So we discussed that initially. 2 of the things that are a little different, doing it out of Gracedown are that, one, we're open on holidays. And so if your holiday, Christmas, Thanksgivings, if those fall on a weekday, the daycare will still be open. That's the goal. So that's not typical. If there's a snow day, to your point, the same thing. So we do want to be able to have that on, it will be a more limited basis, but certainly the goal is to be able to accommodate some of those more emergent situations so that you all know how staffing is at 24/7 facilities when there's a snowstorm. So if we can do anything to help accommodate the childcare piece of that, we will, yes.
Is it open Saturday and Sunday?
Not at this time.
When do you anticipate launch?
Well, I think Mr. Amelia talked about construction potentially being complete by the end of the year. Once council has approved the daycare, we will be able to launch full steam between the Department of Health, Life Safety, and the Department of Human Services with the daycare regs. So there's still a lot of pieces of the puzzle we have to get through, and we can't do that until we have formal approval. And so in an ideal world, those 2 times would collide. So I think Mr. Amelia was optimistic it would be by the end of the year that construction could be complete. And so now, I don't know if he talked about it in detail, but the construction's it is less significant than we had originally anticipated. And I don't think we need too much wood, Mr. Lott, so.
Paint and paper.
Yes. I'm sorry, did I answer your question?
Some. I mean, it's so late, and again, yesterday I made a motion to move this to June 2nd because I didn't want to do this at this hour because I knew it would be the last piece of the puzzle. I guess my concern is, again, there's $2 million for this big project that we don't have it all figured out. And that doesn't mean I'm opposed to it. I'm interested in it, but I wish that my questions could be answered. Well,
I'm happy to answer your questions.
Well, but you can't because
I'm not sure what you.
who's going to apply.
Sure.
You don't know how many kids you need. You don't know how many people they can hire. And I assume they have to go hire staff based on.
We know how many
after
staff they need,
see-
yes.
Well, how many do you need?
8 full-time and 8 part-time.
But doesn't that depend on the room and on the ratios?
The goal
that
is
they
to,
said?
the goal is to staff it, and because we anticipate, we've talked about it, if you build it, they will come. So
So
whether,
you're anticipating full capacity for all rooms?
yes, not in week 1, but very quickly.
I just have concerns. I'm not opposed to children. I'm not opposed to daycare. I paid a lot of money for childcare in my life, and I didn't have the opportunity in those hours. So I think the extended hours are great, but.
I'm
just
happy
have
to
some
answer
concerns.
any other questions and concerns folks have.
Ms. Zirinsky.
Yeah, I just had a comment to speak to Mr. Brown's comments before about the cost of childcare versus the cost of someone who doesn't need childcare. I think that this is an equity issue for working families. Because if you want families with children to be able to re-enter the workforce and be productive and earn a living, we have to give something to them at some point in time. It's almost impossible to work with a small child unless, somehow you can work at home. And even then, the distraction is overwhelming. So I think that to say that we'd have to compensate people who don't have children is sort of like a false equivalency. if we're trying to achieve equity with working families. Because at the core, a person without children is going to take home a lot more pay anyway, because they're not going to have to pay for their children to eat, to sleep, you know what I mean? And all the clothes and everything else. So the expenses of a single person or a couple without children is more about them or whatever their spending is, rather than someone who has to provide for a family. And I really believe it takes a village to raise a child. And we really need to make sure that our village is funded so that our working families are able to work.
Mr. Gafredo.
I'm in favor of, well, let me ask you a couple questions.
Sure.
Because I don't think we have enough information at all. Do you know how many square foot the space would be taking up?
Sure, Mr. Amelie can get that set of plans for you. I think we talked about it yesterday.
You guys have a set of
Roughly how
plans?
many? 3,000 roughly.
3,000 square. Do you have a set of working drawing, anything, conceptuals or anything to
The
go off of?
architects are working on the renderings now for the,
I believe you
for what
said
the construction
last
will
night,
be, right,
Mr.
Mike?
Amelie, that you believe the construction cost to be somewhere around $250,000? Do you still think that number is pretty accurate?
Yeah, I believe around 200,000 is a pretty conservative estimate, given the scope of work.
I'll take your word for it. I'm a little pessimistic that daycare regulations are extremely stringent, especially being in the healthcare sector. It's an old building. It would all have to be brought up to code. Challenges, I'm not going to say it's impossible, but I think there's a lot of questions that we have that we don't have. We have answers to, but we don't have clear answers to. We don't see the design. I very much respect the problems that Mr. Brown is bringing up with, how do you select the parent? Are we allowing multiple children from one nurse? Because does that disqualify you if you have two kids? Because now all of a sudden one nurse is getting preferential treatment by having two of their kids in 30 to 50 spots. I see a lot of potential problems that we could be creating. And I heard Mr. Brown, and I heard Mr. Giovanni speaking before the meeting about child care vouchers. I think with the amount of money that you guys are allotting for the $11,000 in child care costs per year, that could help up to 175 parents. It would be accomplishing the same goal, and we wouldn't be taking on all of the work, all of the liability, and the potential, problems that we could be ensuing by only being able to help 30 or 50 workers when we could be potentially helping 175.
If I can address a couple of those so I don't lose track of what
Yeah,
your
go
points are. I think you heard the ladies talk about the lack of daycares. And so I don't just, that would be an easy path, Mr. Gafredo, to just give out vouchers. It's just not feasible and realistic, and it doesn't provide people with high-quality childcare in and around Gracedown. And given the waiting list, the form I passed out to you all, that Jen passed out to you yesterday, I don't have it in front of me. It talked about the number of children just in Pennsylvania waiting. So that's one issue. The other one, you talked about sort of retrofitting. The good news is, even though it's an older building, when we went through with Jody and Tanya and some other folks, they were very pleased because being a nursing home, we are already up to code with a lot of things. So, fireproof doors or fire-resistant doors and the sprinkler systems. So there's a few significant items that the DOH already requires because it's a nursing home that will make it much easier. So I just wanted to address that.
Question for the ladies in the back. Why are those daycares closing down? I'm assuming it's not from lack of demand. Is it a lack of staff?
Some of it's lack of staff, and just like everything else, because of COVID, people don't want to work with children, or they don't even want to work with the elderly.
And that's kind of what I'm leading to. We've been having an hours-long meeting about how to attract staff. Now we're going to open up another agency, get into the daycare business as a county, and then have to worry about staffing that as well.
That falls on my shoulders.
Sure, but if it fails, it falls on our shoulders. And that's where, these all sound like great ideas, and I think the daycare is a very good idea, but it's a huge undertaking. And like I said last night, if it's done properly, it could be a great thing. But if it's not done properly, it could be a disaster,
Just like anything else.
just like anything else. So,
But you're also neglecting the fact that everybody voted that you could have the 911 center there and the forensics center there.
there's a lot of county employees that are being
Right.
excluded from that.
But a lot could be included
I understand that.
if you let the pilot program start.
And at the end of the day, this is not, Gracedown can make money when it's fully staffed. This is always gonna be an expenditure that very few people are benefiting from and a lot of people are paying for. So I'm trying to make it as equitable as possible. And I don't see 30 kids or 40 kids being a very equitable solution to a place that employs 500 people.
No, the joy of the space that we're starting in is that we're only using about half the space in the entire unit. And so being reasonable and prudent, we're starting small to do it well and to do it correctly. And so if there is a need and interest there, certainly there is the ability to expand. I don't ever want to have to open it up to private paying folks, but theoretically, if the worst case scenario happened, Mr. Lott, you might have mentioned it. I mean, there is a theoretical possibility you could open it up to the general public for paying folks. That's certainly not our intention. We have every reason to believe that it will be full quickly with Gracedown staff's children. And we have space to expand, and we have potentially additional space to expand as well. So I'm not worried about that.
Well, thank you.
You're welcome.
Mr. Heckman?
I have a few questions, and it goes to both you, Sue, and to Jen. I'm somewhat surprised. You've talked about the people that you feel that would want this. We didn't do a survey of staff. You're just saying, I know this would appeal to people. Why didn't we do an informal survey of the staff and say, if we did this, who would like it?
Well, I think you heard Chase Cannon talk about that. When I think Ms. Margot Hefner had him on the call from PACA, and he talked.
Unfortunately, I was in.
You were not there. I'm sorry. So he talked about the fact that it was, I think, hugely ahead of the curve and extremely innovative. And so I think to your point, Mr. Heckman, whether 5 staff want to use it who work there now or 50 staff, we are very confident it will be an excellent recruitment tool. And it might even be a better recruitment tool than a tool with our current staff. But I have no doubt that those slots will be full and full quickly.
All right. With all due respect to PACA and everybody else in the world, as some people pointed out, right now I'm talking about Northampton County. I'm just surprised that we did not do an informal survey of our staff. Just at Gracedown, who's going to benefit from it, saying, hey, let's say we had a daycare here. Who would take advantage of it? And yes, recruitment, but we really are just assuming that number. So we don't really even have a handle on the numbers that are going to use it. The other thing I have is, so you mentioned this, just so I'm clear. Somebody comes in, they have 3 children, and this guy has 1 child. How does that work? Because, I mean, and I'm not getting into the equity because you know what? In life, there's always going to be people who are going to complain, I don't have this, but he has that. And in the county, you're always going to have that. People complain if they don't get the right, if somebody gets a new chair, they didn't get a new chair. So I guess I'm somewhat immune to some of it. Maybe I shouldn't be. But I'm still not clear on, we're going by spaces or people, staff, but we can't really go by staff because if somebody has 3 children, they're taking 3 slots as opposed to somebody has 1 child.
Potentially, yes.
So, I mean, we could end up with just 10 staff members or in the beginning or something like that.
If they each had 5 children, yes.
All right, the third point I'd like to make is, I remember this from management psychology from many years ago, an old survey that goes back a while, the old filing cabinet. They did this experiment where they took sodas, and they said free sodas. They went back after a month, and they found tons of half-empty, half-full soda cans here, there, and everywhere. Then they went and said each soda's 5 cents. Well, lo and behold, most of those sodas that were half drink, they were gone. Because once somebody had a little, in my old skin in the game, once you said, even though it was marginal, it's not free. So has there been, as far as people using this, about them paying a token amount?
Initially, for the pilot program, no, it will be free. If folks are eligible for a daycare subsidy, we would require that they applied for that so that it would help offset the expenses.
All right, and just a thought I have is, I think it's a great recruitment tool and potentially, yes, a great retention tool. But I don't think we have to necessarily, given the cost of daycare, and it's hugely expensive. Most people can't even afford it anymore. A token amount put forward by the person could help defray some of these expenses people talk about. That's all. And I just would say that, again, I mean, I have, and the people that came up, thank you. You know, I'm sure you do a great job and has nothing to do with you. I like the idea. The details yet are a little sketchy for me, but I like the idea.
I have two quick questions if I can, and then I'll send it back. I'm sorry. The employees will belong to them, so they will hire, they will be under their auspices,
Correct.
all the benefits, et cetera.
Correct.
What's the pay rate, starting salary for your childcare workers?
That should, it might, I don't know if that's on the
don't have the
sheet
sheet,
you
I'm
have. Let me see if I have that.
Where? That doesn't tell me what the hourly starting rate is. I'm not gonna do the math at 10 o'clock at night. They should be able to answer me for that.
If I don't have it with me, I can get it for you. The folks gave me a breakdown for
She's right.
director level, assistant director. I found it, there it is.
I just want the hourly starting rate for a childcare worker.
So it depends. So
Lowest
if you are an aide with, and you're a high school student, it's $10 an hour. If you're an aide with a high school diploma with no experience, it's $11 an hour. If you are an aide with a high school diploma with experience, it's $12 an hour. So those are for the aides. So for assistant teachers, you have a college student perhaps who is majoring in early childhood education. That is $12 to $14 an hour. For your early childhood assistant teacher, it's $28,000 to $30,000 a year, which is about $12 to $14 an hour as well. The early childhood associate's degree, lead teacher, would be, I'm sorry, I don't have my glasses on, $14 to $16 an hour, about $30,000 a year. And the lead teacher with a bachelor's degree is $18 to $25 an hour for an average of about $40,000 a year. The manager position is the range, $48,000 to $61,000 a year. Assistant director, $53,000 to $68,000. And those two could be interchangeable, either an assistant director or a manager. And then a director who has a master's degree would be $68,000 to $84,000. So those total, around, this ballpark, yep.
Thank you. Mr. Myers?
That was enlightening, to be honest with you. I am somewhat perplexed by some of the things I'm hearing. The fact that if you have children, that someone else who doesn't have children want to be compensated just blowing me out the water. It just blows me away. It's the dumbest thing I ever heard in my life. If we are educating our people and sending them to college, and they don't, on the college tab, nobody's asking for that money, are they? Am I correct with that? So why the hell would they ask for this? It makes no damn sense to even bring that up. And as far as I'm listening to the salaries, I think we all forgot that a camp for a week is $165. So what kind of money do you think they're going to make? God bless you for the job that you're doing and the fact that we don't have a lot of childcare in the area. And then you, as a man who has 7 grandchildren and a son who works here, he would be dropping off his twin girls and his son. So there'd be 3, and you're gonna tell them one of them's gotta go home? That's bullshit. You know, that's not the way it works. The idea of this is a great idea. I hope it all works out. I give you all the blessings in the world. I'm not gonna beat this thing up. Go for it, you know? We're not doing enough as it is for people.
And just to comment on the staffing piece, because we all know what the hiring challenges are. One of the reasons, so I went to my early intervention folks and I said, tell me the best daycares in town. Tell me who has at least 2 daycares, preferably 3, so they know how to expand and can replicate, an expansion model. And there was only one that my folks told me, and it was these ladies. And they're not gonna, toot their own horn, but what my staff told me, whose own child went there, was they have a much better ability to retain their staff. I'm not saying the pay is phenomenal, but it's certainly as good or better than other daycare providers. But the work environment that they create for their employees has absolutely led them to have better staff retention than other daycare facilities, which anybody with young children whose child has gone to daycare knows how important it is to not have a turnover. So while it's a challenge, I'm not concerned. And as you heard Tanya say, that falls on her.
Go ahead, Mr. Hector.
Just a follow-up, if I may. And look, we've all heard about the wonderfulness of each one of these, and it's like I'm in a dealership for new cars, and I'm hearing, if you buy this, and that's great. And I think, though, that council has bored down because we want, so if this passes, here's what I'm asking, that this program, which I think is raising probably more eyebrows than any of them, for good reason, anything new is you're going to have that, any new thing. Please, keep us informed, just like with the other parts, on our monthly Human Services Committee meetings, on each step of the way, whether the news is good, bad, or indifferent. Because I think the worst thing, speaking from experience, is when a council's sitting there and they find out 3 months down the road about a problem 2 months ago, that people thought, well, let's see if it works out. And often it doesn't. So, I mean, but it's not a sign of failure. It's just being informed and knowing how things are going, and whether it's working out or you're seeing from your end bumps in the road. That's all that's all I can do. I can ask, and I would say, please keep that in mind.
That's a very fair request, and I'm not sure how much more transparent we could be. I mean, we certainly answer any questions that are asked, even if we have to get back to you with the information.
It's not just asking.
Yep.
It's giving. If you're aware of something, and look, I was in an administration too, and one of the rules sometimes could be, if they don't ask, you don't have to say. But that isn't always a good thing with everything. So sometimes if there's an issue that comes up, a problem, if the staff knows it, we're going to know it. So all I'm asking is,
I promise. We just put a compendium together of all the human services meetings since I've been in office, which we're going to present to you at the next human services meeting. And I think you'll see, and the reason for this is I think you'll see council, the iterations of council that I've served with since I was first elected have really asked all kinds of great questions, and we volunteered all kinds of great information. And I promise you, we'll keep you and invite you over to see it and see the progress, and we promise we'll do that.
but you know what I'm saying, Mr.
I do.
Executive.
No, I do.
just-
Look, we can't, this is a daycare. We're not going to be able to hide the problems from you.
right, no,
It's just like with the bonuses, and we're not going to be able to hide it from you.
Okay.
And we won't try.
We understand each other.
Why is it $2 million? I'm missing something on the sheet. I just looked at his sheet.
I'm fine.
Why is it $2 million?
So the construction cost, we talked about, like, we'll say $250,000, and the
Is that what you said?
200,000, not $250,000. But even if it's 250, we'll say it's 250. We said the salary costs are about $417 ballpark a year, and we estimate. I actually rounded that up to about $550 a year to include some benefits for those folks because it wasn't information I had at the time. So I wanted to make sure I was, being as honest and forthcoming as possible. There is the expenses for all of the equipment for each of the rooms, and I don't have a total number of that. I have a giant pack of literally the cost of every single item that's needed for the daycare. Happy to share that. I just didn't have a chance to tally it. And then, then that would allow the daycare to run for, what, 2.5 years-ish. Now I'm testing my math at this time of night. About 2 years, 2.5 years.
Any other questions? Mr. Cusick?
Just real quickly, I think that lays out a good plan, and to address what Mr. Heckman said, when the grant money runs out, it would be possible to charge employees
Absolutely.
for the use of the facility.
If we did not have, if council did not approve funding for that or wasn't available, we would be able to do that.
Thank you.
You're welcome.
Okay.
One question. For the, I assume, because this is part of recruitment plan that you have, will these families also get the recruitment bonuses that council, we talked about earlier? So they be entitled to $2,500 per year in
Yes.
addition to the daycare?
Yep.
Great,
Yep.
thank you.
You're welcome.
There are no other questions or comments. I'd like to call for a vote on the amended resolution.
Well, you had it.
Linda will read it for you.
Sorry, it's been so long.
I understand. Just let her read it.
Want me to read it?
Yes, please.
Okay. Now therefore be resolved that the Northampton County Council hereby authorizes the county executive to direct Gracedown administration to spend $2 million of the American Rescue Plan Act funds at Gracedown on a daycare renovation and operation costs for Gracedown, then 911, and forensic center employees if space is available in the future.
Call for the vote.
Mr. Giovanni. Ms. Zirinsky.
Yes.
Mr. Brown.
No.
Mr. Kuzic.
Yes.
Mr. Gofredo.
No.
Mr. Lott.
Yes.
Mr. Myers.
Yes.
Mr. Heckman.
Yes.
And Ms. Fargo Hefner.
Yes.
Adopted by a vote of 7-2.
Great. Is there any other new business to
No.
discuss?
No.
We have other things. Council committee reports. Whatever we did before today.
Yes. We
Is
had
this
capital
the
projects, we're good to go.
capital
Right
projects
on
good to
point.
go?
The Meadows is going down.
Fruits of everything I talked about, we've done.
Ditto for finance. Any council liaison reports? I have one, I'm sorry, I do. Discover Lehigh Valley, I'll talk really fast, had their meeting on 5/10. They're continuing to work on their marketing plan and branding. They had a governance board additions. Cassie Hilgert is back on the board. Claire Sadler, who is the executive director of DNL Heritage Corridor, and Aaron Ludwig, the community director for Lehigh Valley Hospital Network. The occupancy rate, it's good news, so that's why I want to share it. Northampton County is the highest occupancy rate in this state. Lehigh County is number 2. We have a 74% occupancy rate. We are 10% above the national average. So that's the one thing Norco does good, and it helps us with our hotel costs. So that's what I wanted to report.
That's why you
Anybody
guys
else?
get the big money up here on council.
Council clerk?
Nothing.
Council solicitor?
Mr. Spivey did not give me anything to report to council.
Well, Mr. Kelleher, we are so grateful, and he owes you 5 dinners for this heavy
Absolutely.
lift.
This is the longest we've ever been here.
I make a motion that Chris owes him a lot of
I
dinners.
second that.
All in favor?
Aye.
You've all been very accommodating, thank you.
Thank you, and a motion to adjourn.
Motion.
Motion.
Second. Thank you, guys.